Good evening, one and all. We welcome you all to the International Seminar on Mental Health and Sustainable Development 2022, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and United Nations Sustainable Development Goals 2050-2030 as part of awareness and campaigns, and international webinar series on holistic health, well-being, and sustainable development 2022 in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Arts, Sciences and Well-being. Before we start our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
With the blessings of Almighty, we shall continue to today's sessions. Today, we are commemorating World Health Month. Today is the last day of October 2022. Every year, October 2022, that is October 10th. This year, October 2022, is celebrated as World Health Mental Health Month. And every year, October is celebrated as World Mental Health Month, and 10th October every year is celebrated as World Mental Health Day. So this year, the theme, every year, there is a theme exclusively set for World Mental Health Day. And this year, the theme for World Mental Health Day 2022 is Make Mental Health for All a Global Priority. So World Mental Health Day is marked every year on October 10th to raise awareness about mental health around the world and to mobilize efforts to support those experiencing mental health issues. Every year since 2013, the World Health Organization has organized a global campaign for World Mental Health Day. The World Federation for Mental Health, WFMH, announced the theme for the World Mental Health Day 2022, which is Make Mental Health for All a Global Priority. At the United Nations, various events and activities were organized each year during the month of October to promote the importance of mental health and well-being for our person. And as part of this, on October 10th, 2022, the UN System Mental Health and Wellbeing Strategy team hosted a panel discussion on the importance of creating a healthy workplace to mark World Mental Health Day And the event was opened with a message from the Secretary General that investing in mental health means investing in healthy and prosperous communities. So that entire panel discussion is available on social media. If anyone would like to listen to it, you can ping me. I will be sharing the details, the link with you for the entire panel discussion. So today, as already mentioned, is the last day of Mental Health Month, and the overall objective, as already said, World Mental Health Day or Month is to raise awareness of mental health issues around the world, to mobilize efforts in support of mental health. So this day or month provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people worldwide. So let's see in detail about World Mental Health Day and month, and how this can be taken up in a great way, and how World Mental Health Day occasion or month occasion can help us in achieving sustainable development goals. So while the pandemic has and continues to take its toll on our mental health, the ability to reconnect through World Mental Health Day or month 2022 will provide us with an opportunity to rekindle our efforts to protect and improve mental health. Many aspects of mental health have been challenged, and already before the pandemic in 2019, an estimated 1 in 8 people globally were living with a mental disorder. At the same time, the services, skills, and funding available for the mental health remain in short supply and fall far below what is needed, especially in low and middle income countries. The COVID-19 pandemic has created a global crisis for mental health, fueling short and long-term stressors and undermining the mental health of millions. Estimates put the rise in both anxiety and depressive disorders at more than 25% during the first year of the pandemic. At the same time, mental health services have been severely disrupted, and the treatment gap for the mental health conditions has widened. And growing social and economic inequalities, protracted conflicts, violence, and public health emergencies affect whole populations, threatening progress towards improved well-being. A staggering 84 million people worldwide were forcibly displaced during 2021. We must deepen the value and commitment we give to mental health as individuals, communities, and governments, and match that value with more commitment, engagement, and investment by all stakeholders across all sectors. We must strengthen mental health care so that full spectrum of mental health needs is met through a community-based network of accessible, affordable, and quality services and supports. So stigma and discrimination continue to be a barrier to social inclusion and access to right care. Importantly, we all can play our part in increasing awareness about which preventive mental health interventions work. And World Mental Health Day or month is an opportunity to do that collectively. We envision a world in which mental health is valued, promoted, and protected, where everyone has an equal opportunity to enjoy mental health and exercise their human rights, and where everyone can access the mental health care they need. So World Health Organization will work with partners to launch a campaign around the theme of making mental health and well-being for all a global priority, and it did so. This will be an opportunity for people with mental health conditions, advocates, governments, employers, employees, and other stakeholders, where they have come together to recognize the progress in the field and also have been vocal about what we need to do so to ensure mental health and well-being becomes a global priority for all. So with the campaign slogan, Make Mental Health and Well-being for All a Global Priority, and with the hashtag World Mental Health Day, let's all share and pass on information to everyone across the world. And World Mental Health Day is an opportunity for us to embrace our sense of community and normalize mental health. In 2022, World Health Organization published its seminal mental health work, the World Mental Health Report. The report provides a blueprint for governments, academicians, health professionals, civil society, and others with an ambition to support the world in transforming mental health. On the pervasive issues that reports covers in stigma, discrimination, and human rights violations against the people, mental health conditions, and widespread in the communities and care systems everywhere. Today, Lancet Commission on Ending Stigma and Discrimination in Mental Health is therefore timely and well received. But how will it make a difference? Stigma wears many faces. We most commonly equate it how we treat one another. However, that represents only part of the issue. Personal shame, internalized through an individual's mental health suffering, is a silent problem. We must normalize talking about mental health and its multitude of conditions, because stigma is the chain onto which all mental health conditions link. One strength of World Health Organization's World Mental Health Report is that it includes diverse stories of people living with the experience of mental health conditions. We are grateful to more than 30 people who shared their stories of perseverance and survival. Their courage in telling their story is laudable and humbling. It is by listening to more and more experiences like theirs, we can learn how to offer better services, support, and normalize conversations. So that same is true of the recent World Health Organization guidelines on mental health at work, with an estimated 12 billion workdays lost annually due to depression and anxiety. The new guidelines recommended actions to tackle risks to mental health in workplace, such as heavy workloads, negative behaviors, and other factors that create distress at work. Each week brings a new challenges to our personal and collective mental health. Conflict, disease, and climate call for a new type of resilience in our mental health. Without expressing and understanding it, we'll continue to paper the cracks. Reflecting on the ambition for this year's World Mental Health Day, there are 4 priorities World Health Organizations would like to see acted upon. Those 4 priorities are fund, upskill, prioritize, listen. Fund mental health activities and services. It is estimated that countries spend less than 2% of their healthcare budget on mental health services. With approximately 1 billion people living in a mental disorder in 2019, services are radically undersourced. Upskill ourselves and our caregivers with an understanding of mental health, understand fully personal experiences and how to provide support. the World Health Quality Rights Mental Health e-training is a great place to start. And the training was designed to improve the quality of care in mental health and related services and to promote the rights of people with psychosocial, intellectual, and cognitive disabilities. So prioritize mental health through our own self-care, analyzing workplace practices to ensure employees thrive and ensuring there is a strong community care for mental health. So listen to the voices of people with lived experiences of mental health conditions. Their experience will teach us how best to support and take care of them. Mental health conditions are usually painful, and unfortunately, stigma only amplifies the distress. Let's embrace these wise words of the year's World Mental Health Day theme and make mental health and well-being a truly global partner. As quoted by Director of Mental Health and Substance Abuse, Mental Health, World Health Organization, Deborah Keston. And as part of this, as already mentioned, the global launch of World Health Organization Quality Rights e-training on mental health. Close to 1 billion people have a mental health condition and anyone, anywhere can be affected. Yet, despite the universal nature and the magnitude of mental health conditions, the gap between the demand for mental health services and supply remains substantial. Relatively, few people around the world have access to quality mental health services, and stigma, discrimination, and human right abuses of the people with mental health conditions and remain widespread. Throughout the quality rights initiatives, World Health Organization is supporting governments and policymakers to transform mental health systems so that they are based on recovery, rights, and inclusion. Particular focus has been given to the reforming policy, law, and services, as well as actions to build the capacity of key stakeholder groups to address stigma and discrimination, and to understand and implement rights-based approaches in services and the community more broadly. As part of this work, several key capacity building tools have been developed, including the Quality Rights e-training platform on mental health, recovery, and community inclusion. So feedback from earlier adopter countries of online training have been very positive, with the evaluations indicating significant shifts in mindsets on issues such as providing people with choice and information about treatment options, implementing of alternatives to seclusion and restraint, and promotion of recovery, hope, and community inclusion. So this global launch of the training is expected to create significant momentum for an accelerated rollout to thousands more people in more countries. A launch, nearly 30,000 people has completed training, and the goal is that 5 million people will have completed training by end of 2024. So this event will be moderated by Sir Norman Lamb, Chair, South London, and Maudsley NHS Foundation Trust, United Kingdom of Great Britain and Northern Ireland. So he will be joined by guests including Dr. Tedros, Dr. Oliver, Dr. Marta, Dr. Michaeli, Dr. Ms. Cynthia. Let's watch a short video. We'll take it at the end of the session. Okay, so how do we move towards these mental health issues? or in promoting mental health. There are various domains or sectors or areas where we can work uh, towards promoting improving mental health. Preventing intimate partner violence improves mental health. In the pandemic, we have seen a lot of people were confined into the closed rooms, closed spaces, where these family members were confined to their homes and their flats. So there was a lot of intimate partner violence that was erupted. We have seen a lot of calls and also these complaints regarding partner violence, domestic violence, and intimate partner violence. So this is still continuing, and a lot of diverse cases also raised in the pandemic and post-pandemic. So with this more awareness, survivor-centered services, research and policies are needed to transfer mental health care systems to properly support survivors of intimate partner violence. And not only just intimate partner violence, the violence or abuse among the family members also raised, especially towards children, towards youngsters, teenagers, and towards elderly people also. So there are different areas and different kind of issues that were faced in terms of violence, abuse, trauma. So there should be some network support system that can address and support survivors of violence, abuse, discrimination, and trauma. Intimate partner violence was the most common form of violence against women, affecting 641 million women and girls today. It profoundly impacts their mental health, increasing risks of depression, anxiety, and other mental health problems. Unfortunately, the critical and often destructive links between violence and mental health have been long neglected. The World Health Organization, which works to prevent and respond to gender-based violence through the health sector, contributed to the first of its kind 2022 Lancet Psychiatric Commission on intimate partner violence and mental health. So this commission brought together international experts from a variety of backgrounds and academics, clinicians, and those who lived with experience. It was convened to consider progress in reducing the prevalence of intimate partner violence and associated mental health harms, and to establish a roadmap for strengthening responsive across mental health services, research, and policy. Evidence shows that intimate partner violence profoundly affects survivors' mental health. Worryingly, when seeking care, services are often found to be lacking. About 2/3 of the women receiving mental health services have experienced intimate partner domestic violence, a number of higher than general population. Sadly, many survivors report finding services unhelpful, harmful, or even re-traumatizing. So raising awareness to understand the connections between intimate partner violence and mental health, and training healthcare providers in how to look for signs, ask for right questions in right way, are key steps to address violence and its consequences and prevent future violence. Services should be designed to sensitively identify clients living with or affected by intimate partner violence and establish how they can be supported, as opposed to concentrating only on the symptoms. So the commission called for a drastic shift in the way the mental health system works. Rather than strict categories and diagnosis, we need an approach that recognizes survivors' experience of violence and put their needs front and center of research, policy, and services. As quoted by Claudia Garcia Marino, World Health Organization Unit Head of Addressing Needs of Vulnerable Populations in Sexual and Reproductive Health, and also an author of the Commission. So data from World Health Organization and Joint UN Special Research Program, HRP, that is Human Reproductive Program, under the collaboration with UNDP, UNFPA, UNICEF, WHO, and World Bank, an working group on violence against women estimation, and data shows that violence against women is a global phenomenon of pandemic proportions, but remains marginalized both by society and healthcare providers and policymakers. The Commission has found out that reducing intimate partner violence could substantially improve the mental health of community members in all countries and settings. This is especially true for women and children, as the data indicate intimate partner violence is rooted in ongoing gender inequality and exacerbated by other inequalities. An estimated 27% of the women and girls older than 15 years have experienced physical or sexual intimate partner violence globally, although rates are much higher in some regions and countries, and also the statistics might be much more higher because many go unreported and most aggressors are men. So evidence shows that both women who experience intimate partner violence and children who are affected either directly or indirectly are at higher risk of developing mental health conditions. Men perpetrating intimate partner violence may also be at higher risk of mental health conditions. So what is the way forward for this? Recognition of the association between intimate partner violence and mental health conditions has grown in the past 10 years, but huge gaps and areas of improvement remain, as said by Professor Helen Fisher from King's College London, UK, co-director of the UKRI Violence, Abuse and Mental Health Network, and also author of the Commission. Improving understanding of the links between violence and mental health is the first step. The next step is to train people in how best to address these often severe and ongoing issues. More research is needed to know which groups of people benefit the most from a variety of interventions. It is especially unclear what support and interventions work best for children who have witnessed or exposed to intimate partner violence. Geographic and cultural context are important in planning safe and effective approaches to prevent and for prevention and care. The Commission cites a body of research from low and middle income countries that show a wide spectrum of findings. Ultimately, the greatest need is to ensure that people in every setting have access to effective, empathetic, and person-centered mental health care, especially increasing access and understanding in resource-poor settings. Commission authors hope the report will contribute to strengthen policies and services that prevent and respond intimate partner violence and improve mental health. So the key recommendations as part of the Commission is more investment in prevention and services for violence survivors. Working closely with the mental health services is needed to address intimate partner violence. Mental health services must use gender-sensitive and trauma-informed approaches co-produced with survivors, and train healthcare staff in gender-based violence and survivor-centered approaches, and especially in appropriate ways to assess and respond to intimate partner violence among individuals who come into contact with their services. Practitioners should also ask all the mental health service users about experiences of violence, including intimate partner violence. Assessment should be done in private by trained practitioners using the World Health Organization's LIFES principles for the first line response and working with a clear referral network. Children and adolescents with emotional behavioral problems should be assessed for exposure to intimate partner, domestic violence, and be offered specific interventions alone and or with their caregivers as required. Researchers should also include intimate partner violence as a potential moderator of treatment response in intervention studies and ensure it is measured in new population-based cohorts. They should also improve coordination and cooperation across sectors regarding both data and collection for intimate partner violence and core indicators outcomes to assess interventions to reduce partner violence, ensuring these reflect the priorities of all survivors. And today, there is one more major problem or issue associated with mental health is stigma. So knowledge is power. Tackling stigma through social contact. So stigma, which is pervasive in general population and in the health sector, is a major barrier to improved mental health services and self-help care. And it is present in homes, schools, workplaces, communities, and even without mental health care system itself or within the mental health care system itself. People will often choose to suffer mental distress without relief rather than risk the discrimination and ostracization that comes with accessing mental health services. Stigma among primary care providers likely contributes to the low rates of detection of mental health conditions in primary care. Stigma leads to social isolation and discrimination, which impacts a person's ability to earn an income, have a voice, gain access to quality care, be part of the community, and recover from their mental health condition around the world. People living with mental health conditions are frequently excluded from the community life and denied basic rights. They are also discriminated against in the fields of employment, education, and housing. In all cases, stigma and discrimination can adversely impact mental health and hinder people's recovery. This is why often mental health issues are underreported or even at times not reported at all. Suffering through stigma, we have a case study where Angelica lives with obsessive compulsive disorder in Zimbabwe. She explains that there are few psychiatrists in her country and that conditions like OCD, that is obsessive compulsive disorder, are largely ignored. For years, I thought that maybe I was bewitched or cursed or possessed by evil spirits. She says, I had to go through this alone because of my fear of stigmatization. I could not even tell my husband. I was scared my loved ones would desert me. My church could not help. No priest understood what I was going through. There was no support groups in the whole country. Angelica's experience is all too common. For the longest time, I was afraid of speaking about my battle with the mental health because of stigma attached to it, says Oderlang Castle in Botswana. The single-sided story of bipolar disorder in my community focused only on the struggles it caused rather than how to overcome them. I was afraid, lonely, and didn't believe that healing was possible, as said by Castle. For others, like Lion Guy Mer in Israel, the stigma from health professionals rather than community. I've used various rehabilitation services over the years and have encountered ignorance and stigma. Some services were just unhelpful to me, some actively harmed my recovery journey. She says, I will never forget the nurse in the psychiatric ward who chased me around what she caught me doing yoga in my room. And it took me 10 years to start doing yoga again, adds Lion from Israel. So we have seen 3 case studies internationally, and there is shifting attitudes that tackling stigma is not easy, but experience shows it is possible. Large-scale awareness campaigns can create positive changes in public attitudes, and approaches based on social contact with people with mental health conditions are known to be particularly effective. Peoples with a lived experience, including in peer-led organizations, can be important agents of change. Like Oderling became a mental health advocate as part of her recovery. I made a pledge to myself to use the lessons I would learn to help others. I'm passionate about encouraging people to begin their healing by overcoming stigma and speaking up openly about their mental health condition, she says. By Oderling, Angelica similarly uses her lived experience to help others. She runs a support group through a non-governmental organization that she has set up in 2018. We used to meet face-to-face once in a month before COVID-19. Now we meet online. She says, I also give talks on the radio and at local events. Our work has been featured in newspapers and magazines. She added, so anti-stigma strategies can also be targeted at health workers are an important component efforts to improve quality of care for people with mental health conditions. World Health Organization's Quality Rights Initiative, for example, develops and deploys training materials, toolkits, technical support, and practical guidance to help combat stigma and discrimination and promote inclusion and recovery. For Lion, promoting person-centered services and practices that support recovery is important. The difficult experiences I have been through and the ignorance I have encountered has also led me to lecture in therapeutic circles. She says, at first I was begging to be heard. She adds, but slowly I have been invited to give more and more paid lectures. The need had probably existed for a long time. The therapist desired to learn and improve the existing therapeutic services, filled me with hope, as said by Lion. Everyone has a right to mental health. Everyone has a right to participate fully in society free from stigma and discrimination. So with this, I shall stop here for some time, and we will take up sessions from our presenters today. Then I will continue my rest of the sectors where we can make contributions. So we will move on to next session, before that, we request everyone to fill the feedback form for session 1. We have 5 minutes. So we request everyone to fill up the feedback form. Feedback form has been raised in the form of polls in Zoom. So do not close it until you submit it. And enter all the details. It is mandatory and will help you in getting your certificate. So we have 5 minutes. Dear friends, quickly fill the feedback form. We will have next session by Christina Keegan from Nigeria. After closing this feedback form, we will invite her. So dear friends, quickly everyone fill up the feedback form. Feedback form has been raised in the form of polls. If you have accidentally closed it, or if you are accessing from browser, you may have difficulty in accessing. If you have accidentally closed it, then you can find in the Zoom below there are options. In that more, you can click on polls and then you can see the active poll. Kindly do not close, be active, stay with the connected with your devices, don't switch on and leave, or do not attend to any other work. Quickly fill up the feedback form. You can access in the from the menu. There will be an option. And if you are unable to see or access feedback form, don't worry. But try to ensure that you are filling up the feedback form. Otherwise, you can also leave your details, but the first priority should be through the form. Otherwise, you can just leave it in chat box by selecting post your details along with the feedback. Feedback form is active. Already 9 members have completed their feedback. So quickly fill up the feedback form. Others also quickly submit by filling it up. Others who are not accessible, kindly join from Zoom app. If you are logging in from browser, you may have difficulty because from browser we'll have limited functionality. You can join, install Zoom app on your mobile or on your device. Or if you are not seeing it, you can update your app also and rejoin. Otherwise also you can select the host and mention your details along with your feedback on the session. No need to worry about feedback form. You can use chat box also to share your feedback along with your details like name, designation, organization, and kindly do not leave. The session is not yet over. Only first session has over. There are other sessions and you need to fill feedback for every session because our friends will keep joining and leaving. So that will help us to collect data for each session. Once closed, we cannot relaunch the feedback form. So quickly fill up the feedback form. Don't think we can fill it later. That is platform limitations. We cannot relaunch again. So quickly fill up the feedback form. It's already 7 minutes. Kindly quickly fill up so that we can move, save some time. So we are moving to our next speaker, Christina again from Nigeria. She is professional social worker. So we'll move on to our next session. We invite Ms. Christina Kigan, Nigeria social worker, for her topic on mental health as integral part of sustainable development.
Good afternoon, Doctor. Thank you for this opportunity to present and share knowledge in the ongoing seminar on Mental Health Month. Thank you, colleagues, for paying or creating time to be here to add knowledge and value to our already existing knowledge. Thank you very much. I have listened to you, Prof, present on your topic, and I picked something concerning stigma and management of mental health, and what stigma as one of the factors that hampers management of mental health. I have, in my practice over close to a decade, I have seen that played out. Even stigma in the family where people are expected to feel safe, and that also aggravates or leads to self-stigma by patients, which makes them hide or which makes them delay seeking medical attention, which is made available. Thank you very much for helping us or for throwing more light in that regard. Thank you, Doctor. I'll go straight to my topic without any delay. I'm presenting on the topic mental health as an integral part of the Sustainable Development Goals. Sustainable Development Goals, as found out during my research, is no longer a unique, or is not an issue peculiar to just one country, but it is a universal goal that is that cuts across countries, both the rich countries and the poor countries. So it cuts across all countries. Looking at the 17 goals presented, let me quickly run through what the goals are by way of introduction, so that when I go into the discussion proper, I will not have to, when I talk about the SDGs, we'll know what we're talking about. Is everybody getting me? Is everybody getting me, so that I continue, carry each other?
Yes,
carry
please continue, Christina.
Okay, so I want to run through the SDGs, so that when we talk about SDGs, we'll know what we're talking about. We have 17 SDGs, which are no poverty, no hunger, good health, quality education, gender equality, clean water and sanitation, clear energy, good jobs and economic growth, innovation and infrastructure, which is the 9th social development goal. And also we have reduced inequality, sustainable city, responsible the planet, life below water, life on land, peace and justice, partnership for the goals. I had to run through this 17 goal by way of introduction, so that I'll keep mentioning SDGs, and then I don't have to mention it in some point in the course of the discussion. But if it requires me to mention some by way of emphasis, I will do that. So I go straight to the discussion by introductory. I started by saying mental health as an integral part of the Sustainable Development Goal, which has good mental, is good mental health is related to the ability to reach the SDGs. Now, without good mental health, it is difficult to attain all the mentioned SDGs. So good mental health is related to the ability, or gives us the ability to reach the SDGs, as the very definition of mental health as reflected by the World Health Organization, which is complete mental and social well-being, and is not merely the absence of disease or infirmity. That definition of health.
There is some lag, Christina. Maybe some network issue at your end.
WHO mental health is total, including physical. Hello, can you hear me?
Yeah, now it's fine. Yeah.
Okay, let me take the mic close to my mouth for audibility. I started by saying mental health as an integral part of the Sustainable Development, as captured in my topic, is good mental health as related to the ability to reach the SDGs. As the very definition of health states, health is being in a total state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The SDG are universal and mental health concerns, all whether rich or poor. In my introductory, I said the SDGs is a universal a thing and not peculiar to just one country, both the rich and the poor countries. And I also said that moreover, the need for interdisciplinary and intersectorial solutions to reach the SDGs is highlighted, which provides a window of opportunity for mental health, as this is a field where cooperation across sectors and professions is central. In the management of mental health conditions, it includes or encompasses interdisciplinary members, which has the doctors, the nurses, the psychologists, the social workers, and other fields of therapy like the physical and health therapy, occupational therapy, and name them. So it's a section of health that brings in intersectorial solutions using different professionals. We argue that efforts to eradicate poverty, prevent conflict and disasters, and promote education will not be successful unless mental health is made a priority or is prioritized. Poor mental health and unfulfilled human potential pose major risks to the changes that are needed if we are to reach the SDGs. Poverty, marginalization, violence, complex emergencies, and violations of human rights threaten both human development and sustainable economy development, and constitutes an important context for global mental health. We talked about stigma increasing the rate of mental health or hampers good management of mental health. These other factors that are associated or mentioned in the SDGs or the SDGs aims to address can also promote or hamper good mental health management. For the first time, mental health is explicitly included in the universal agreed goals, providing an opportunity to enhance mental health and well-being across countries and professional disciplines. To fully use this opportunity, care for people with mental illness and psychosocial disabilities, as well as promotion of resilience and mental health well-being generally must be prioritized. Another good news for we practitioners is that the mental health issues are becoming more in the fore. This means that before now, mental health issues are neglected. A lot of the times before now, people spiritualize mental illnesses, and okay, they give it different connotations, saying somebody has done something somewhere and not paying attention or not knowing that this is also an aspect of health that needs attention and has provision for management. But thankfully, because it is becoming more rampant, researches are also on the increase. So it makes people seek help. And even the stigma issues that are mentioned in the last presentation are not the way it used to be before now. It is reducing with the increased knowledge in mental health. The keywords in my presentation are global health, sustainable development goals, poverty and health, poverty, healthcare, and public health. Mental health and psychosocial well-being were defined as an integral part of health by the World Health Organization in 1978 and have been addressed in many UN resolutions. However, it is only recently that mental health has been included on the unified global agenda. When world leaders adopted the Sustainable Development Goals in 2015, world leaders adopted the SDGs in 2017, they also committed to prioritizing prevention and treatment of non-communicable diseases, including behavioral development and neurological disorders, which constitutes a major challenge to sustainable development. Thank God, or thankfully, mental health is also gaining the attention that is required, like every other diseases, inclusive of communicable diseases. The Sustainable Development Goals built on the experiences of the Millennium Development Goals The aim of the SDGs agenda is to eradicate poverty and hunger, promote inclusion, human dignity, equality, protect the planet, promote growth, and foster peace and justice. The SDG figure 1 consists of 17 goals, which have been mentioned in the opening. Specific references is made to mental health and substance abuse under goal 3. We have goal 3 being good health. So mental health and substance abuse is captured in goal 3, which is about good health. Also, on premature mortality from non-communicable diseases aims for reduction by 1/3 through prevention and treatment and promotion of mental health and well-being, and addresses prevention and treatment of substance abuse. Moreover, as pointed by the Izitsu et al., the rights of people with disabilities are referred to specifically in goal 4. The goal 4, which is quality of education. And 8 is good jobs and economic growth. Goal 10, we have reduced inequality. So people have suffered discrimination on the basis of mental health, and one of the SDG goals is reduce inequality, which also has the capacity to address the issue of stigma. And lastly, goal 11, which is sustainable cities and communities, which is relevant for people with mental illness, intellectual and psychosocial disabilities. The SDG provides a rationale and a framework to address mental health from many perspectives with renewed urgency. The universal goals that concerns us all, one aspect of the SDGs that is new is their universality, not merely being goals for poor countries. Likewise, mental health concerns us all. So the whites break down mentally, the blacks break down mentally, and all races can experience or can have mental health challenges. And this tells us that as long as we have brains, as long as we all have brains in our skulls, we are already vulnerable. All we need is we need to put into consideration is the preventive aspect of health, and also good knowledge to manage in the event of breakdown, because sometimes these mental breakdowns happen not by our own volition or our own wish, but it happens. For example, people experience accidents, or people are involved in accidents and they sustain head injuries. They come down with mental health challenges. So knowledge of mental health in totality, inclusive of management, inclusive of care, is very, very vital. And it is said that it cuts across all strata of persons, including the rich and the poor. Even the rich countries, the poor countries, the most privileged families experience mental health problems and are confronted with the suffering associated with mental illnesses like depression, suicide, or substance abuse. Another prominent aspect of the SDG is that they are multi-sectorial, and that innovations and progress in one sector will impact another. In addition, in order to reach the goals, it will be necessary to collaborate across sectors and disciplines. Similarly, reaching the goals of promoting good mental health and well-being for all, and providing good and dignified treatment for those in need required multidisciplinary cooperation, like mentioned in my earlier discussion. The solution will not only be found in the health sector. The final SDG goal is to ensure good partnership. Partners for mental health include civil society, private sector, government and non-governmental organizations. Lessons from this partnership may be applied for the overall SDG agenda. And I want to add that it takes collaborative efforts to manage mental in the management of mental health or mental illnesses, and that also includes family, which plays the role of good social support. And we in the course of practice, we know the role that social support plays in recovery and sustainable well-being for the mentally ill. With good social support, they tend to stay longer well. With bad social support, they tend to break down more often, and also increase knowledge in the area of mental health, which in my country, Nigeria, people are beginning to be more informed of mental illness and seeking help. Well, regardless of stigma, is increasing. So I pray that it will get to a level where people can walk in to seek help for their mental well-being, like they will go to the hospital to seek help for other medical conditions. We're making little progress daily, but we're not there yet. People are still hiding. People are still suffering from stigma of discrimination, even at work. But it is reducing here in my country, and I pray that these SDG goals will, at the end of the day, achieve more in the area of mental illness or prevention. Thank you very much. Any questions?
Thank you, Christina, for your wonderful insights. Any participants, if you have any queries, you can raise your hand. If there are no queries, then we'll move on to our next session, and we will take any queries, if any, at the end of the sessions. So kindly fill up the feedback form for session 2.
Thank you very much, audience. Thank you also, Dr. Ravindra, for creating this great platform for us to learn. I'm happy to present this, and I also want to add that wherever we are in these various countries, we should continue to promote issues of mental health, because it is becoming more and more and more common, even in children, from childbirth, traumas from childbirth, from childhood, adolescents, growing up. People have different experiences, which are the reasons for increase in mental breakdown. Thank you very much. I wish us all the best in our endeavors, and I pray that we'll continue to seek help as it is made available. Thank you.
Thank you, Christina. It was a really very insightful sessions, and we wish you all the success and look forward for more sessions in future.
Thank you very much, Doctor. Thank you, everyone.
Thank you. Dear friends, feedback form has been raised for session 2. So kindly fill up the feedback form so that we can move on to next session. Dear friends, quickly fill up the feedback form for session 2. Dear friends, quickly fill up the feedback form so that we can move to next session. Our next session will be by Mary Florence Frida on schizophrenia. Now I invite Mary Florence Frida. She is professional social worker having more than 16 years of experience, and she is founder Mary Florence Frida Charitable Trust, and she is also a research scholar in Bangalore University. Yeah, you can unmute yourself, Mary. You can start your video and start your presentation now.
Good evening to all. I firstly thank Dr. Ravindra Sir and his team, Sri Holistic Health Foundation and Sri Research Institute of Center for Arts and Science for giving me an opportunity to present a paper on schizophrenia. Uh, Thank you very much, sir, for the opportunity. I will go and present on the topic schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. Schizophrenia is not common as other mental disorders. Their symptoms and signs are very disabling. Symptoms and signs. The symptoms of schizophrenia usually starts with the age of 16 to 30. In rare cases, children have schizophrenia too. The symptoms of schizophrenia fall into three categories: positive, negative, and cognitive. Positive symptoms include psychiatric behaviors not generally seen in healthy people. People with positive symptoms may lose touch with some aspects of reality. Another positive symptoms are hallucinations, delusions, thought disorders, unusual or dysfunctional ways of thinking, movement disorders, agitated body movements. Negative symptoms include associated with disruption to normal emotions and behaviors. Symptoms are follows: flat affect, reduced expressions or emotions, facial expression or voice tone, reduced feelings of pleasure in everyday life, difficulty beginning and sustaining activities, reduced speaking. What are the cognitive symptoms of schizophrenia? Some of patients experience cognitive symptoms of schizophrenia are subtle, and for others they are more severe, and patient may notice changes in the memory or other aspects of thinking. Symptoms include a poor executive functioning, the ability to understand information and use it to make decisions. Another cognitive symptoms is trouble forcing or paying attention, problems with working memory, the ability to use information immediately after learning it. The risk factors of schizophrenia are: there are several factors that contributing to the risk of developing schizophrenia. Uh, One is include genes and environment. Scientists have long known that schizophrenia sometimes run in families. However, there are many people who have schizophrenia who do not have a family heritage with the disorder, and conversely, many people with one or more family members with disorder who do not develop it themselves. What are the environmental factors that contribute to the uh, schizophrenia mental disorder? Scientists also think that interactions between genes and aspects of the individual environment are necessary for schizophrenia to develop. Environmental factors may involve exposure to viruses, malnutrition before birth, problems during birth. What are the other environmental factors? The another environmental factors are psychosocial factors. Scientists believe that many different genes may increase the risk of schizophrenia, but not one single gene causes the disorder by itself. It is not yet possible to use genetic information to predict who developed schizophrenia. What are the clinical causes which uh, define schizophrenia mental disorder? Different brain history structure. The scientist thinks that an imbalance in the complex of irrelated chemical reactions of the brain involving the neurotransmitters, substance that brain cells use to communicate with each other. Dopamine and glutamate are the others. Glutamate and others play a role in schizophrenia. Clinical causes, some experts also think problems during brain development before birth may lead to faulty connections. The brain also undergoes major changes during puberty of a lady, and these changes would trigger psychotic symptoms in people who are vulnerable due to genetic or brain differences. Treatments and therapies. What are the treatments and therapies of schizophrenic disorder? Because the causes of schizophrenia are still unknown, the treatment focuses on eliminating the symptoms of diseases, and treatments include antipsychotic treatments. Antipsychotic medication are unshaken daily in pill or liquid form. Some antipsychotics are injections that given once or twice a month. Some people have side effects go away after a few days. Doctor and patients can work together to find the best medication or medication combination and the right dose. Antipsychotic treatment uh, is the patient's medication, and follow-up should be followed, and regular treatment to the psychiatrist and to the psychiatric social worker or psychologist should be done. What is a psychosocial treatment? The psychosocial treatment is are helpful after patients and the doctor find a medication that works. Learning and using coping skills to address the everyday challenge of schizophrenia helps people to pursue their life goals such as attending school or work. Individuals who participating in regular psychosocial treatment are less likely to have relapses to be hospitalized. What are the treatment for psychosocial treatment according to National Institute of Mental Health and Neurosciences is coordinated specialty care. This treatment mode integrate medication, psychosocial therapies, case management, family involvement, supported education, employment services, aim to reducing symptoms and improvement quality of life. The National Institute of Mental Health Recovery, after initial schizophrenia uh, episode, that is research project. Psychosocial treatment also includes fundamentally change the trajectory and prognosis of schizophrenia through specialty care treatment in the early stages of disorder. RAISE is designed to reduce the likelihood of long-term disability that people with schizophrenia often experience, help them to lead productively and lead an independent life. What are the remedies of to cure schizophrenia diseases? get them treatment and encourage them to stay in treatment. Remember that their beliefs or hallucination seem very real to them. Tell them to acknowledge that everyone has the right to see this things in their own way. Other remedies is respectable to the patient, supportive family treatment, tolerating tolerating dangerous or inappropriate behavior shown by the patient, and other research studies which are done through is one are the clinical trials, are the researchers that look at new ways to prevent, detect or treat disease or condition including schizophrenia. During clinical trial, treatments may be new drugs or new combinations of drug, new ways or to use existing treatments. The goals of clinical trial is to determine if a new test or treatment works, and it is a safe treatment. Another research study is, although individual patients may benefit being a part of clinical trial, participants should be aware that the primary purpose of a clinical trial is to join new scientific knowledge, and so that others may be helped in the future. Research study decisions about whether to apply for a clinical trial and which ones are better suited for a given individual are the best made in collaboration with the licensed health professional. The research statistics include psychotic disorders research program. This program support research into the origin, onset, cause and outcome of schizophrenia, spectric disorders, and other psychotic disorders. Another research studies according to National Mental Health and Neurosciences RAISE is a large-scale research institute initiative that began with 2 studies examining different aspects of coordinated specialty care, the CSC, treatments for people who are experiencing first episode psychosis. Another findings according to National Institute of Mental Health and Neuroscience, study recruiting participants with schizophrenia by using clinical trial or the or a regular follow-up to the psychiatrists and to the psychiatric social worker. Thank you very much, sir. I sincerely thank Dr. Ravindra sir and Sri Holistic Health Foundation for giving me an opportunity to present my presentation on schizophrenia and on the occasion of Azadi Ka Amrut Mahotsav Independence celebration. Thank you very much, sir.
Yeah, well presented, Mary. It gave wonderful insights into schizophrenia and its treatment. Yeah, so participants, dear friends, quickly fill up the feedback form for session 3. Then we'll move on to next session. We have 5 minutes. You can close any open poll windows. And feedback form for 3 has been launched. Quickly fill up the feedback form. Dear friends, quickly fill up the feedback form. Next session would be Virendra Kumar Thakurji. After closing the feedback form, we shall invite sir for the presentation. Dear friends, quickly fill up the feedback form. Dear friends, quickly fill up the feedback form. We are moving to next session. We have with us Ravindra R M from Govind Vallabh Pant Institute of Engineering and Technology, Uttarakhand. He is RTA resource person, advocate, and assistant professor in computer science and engineering. So, we'll be presenting on mental health and legal profession and practice. Over to you, sir. You can unmute yourself, start your video.
Yes,
The whole window is on. Kindly minimize it instead of closing it.
Yes, sir. I am able to unmute. My video is also on. Yes.
Yes.
I'm making my presentation shareable now. Today it's a small presentation, just 20 slides. My topic is mental health and legal profession and practice. Now this point can be viewed from two different viewpoints. First is the mental health of advocates themselves. We are not talking about that. That is not my topic. Advocates are trained in quarreling. It may sound very strange to other professions, but the training is they have to wear black coat. They have to go and fight with 5 to 6 contestants every day minimum, and that's why by nature they become quarrel. And it's considered a good trait. It's not a bad thing for advocate, because if they are not quarrelsome, nobody will hire them. Well, that is one thing, negative aspect, because of which they become quarrelsome. Another is they are trained to disrespect. So their training is if the opponent may be very eminent lawyer like say Ram Jethmalani or Kapil Sibal, but they have learned the same books, they have learned from the same books which are available to you also. So it all your hard work, your intelligence, your arguments, your pleading that matter and nothing else. So there is a training of disrespect. These things give rise to some types of problems. There are some other traits that are required for judges in judiciary. That is, say if we argue with somebody even for half an hour, our entire day gets spoiled. That this person argued with me nonsense and wasted my time. But see, the judges, if a judge looks after say 40 cases or 15 cases in a day, now if there are 40 cases, there are 80 parties. That means he has to hear to at least 80 persons and listen to their arguments, argue with them, and try to convince them, and then finally pass a judgment that should not be challenged, that should be legally sound, and it should not be challenged in, let's say, superior courts. So write such type of judgment. So that is really a tough job if we think from that viewpoint. Well, we are not going to enter into those things. Here the topic is not mental health of advocates, but entirely different. That is, as far as legal profession and practice, how they encounter different types of cases related to mental health. This term comes in Contract Act, that is person of unsound mind. Earlier there was Pagal Act, that is say Genetic Act of 1912. Then there was Mental Health Act of 1987. Now we have Mental Healthcare Act 2017, which we have already considered in detail. So Mental Healthcare Act explicitly talks about the rights of patients with mental illness. Here we call them PWMI. PWMI are patients with mental illness. So we use that term instead of lunatic or pagal word nowadays. So PWMI are patients with mental illness, and lay down the ethical and legal responsibilities of mental health professionals and the government. The rights of PWMI are at par with the fundamental rights of human beings, and because this law has been drafted as per the international agreements or obligations of Government of India. So in one of my earlier presentations on one Sunday, I have already covered that in detail in my another presentation. So we shall not enter into details of this act today. So it deals with fundamental rights of human beings and need to be clearly talked about as they belong to a vulnerable group from evaluation, treatment, and research perspectives. Such rights translate into the ethics of psychiatric care that relate to respect for autonomy, the principle of non-malfeasance, beneficence and justice, confidentiality and disclosure, boundary violations, informed consent, and involuntary treatment, etc. So we'll discuss the ethical, legal, and related issues in this presentation. So let us see one by one different types of. First of all, of course, the major act, that is the Mental Healthcare Act, that is the main legislation at present. So in their article pertaining to MHCA 2017, the authors, there is one article by A. Jagdish, F. Ali, M. R. Kauda. They have critically evaluated the pros and cons of the new act. They comment the act for endorsing the rights, especially insurance of PWMI, because there is provision for insurance also, which is a new provision, and recommending this decriminalization of suicide. That is, there is overriding effect over IPC 309 in this attempt to suicide, and the lesbian, gay, bisexual, transgender questioning or queer, that is queer gender community. For this, there is one judgment of Supreme Court in 2013, and they have distinguished the lesbian, gay, and bisexual from the transgenders. And based on that, now the new Transgender Act has come into effect. It has been passed by Parliament in 2019. Maybe I will cover that on some other day. The Supreme Court in its judgment had stated that lesbian, gay, and bisexual is related with sexual preferences. That is, lesbians are female homosexual, gay are male homosexual, bisexual are those who have sex with male and female both. So these things are related to sexual preferences, whereas transgenders are different types of persons. That is, it could be by birth, it is a type of handicap, and they are defined as sexually handicapped persons, which is a special type of physically handicapped, and they have been given certain rights within that act. That is a separate topic, so I will not go into details of that here today. They also mention the non-representation of the Indian Psychiatric Society and inadequate address of the burden of care experienced by the caregivers. The caregivers of PWMI, that is persons with mental illness, are the real ambassadors of mental health. They sincerely understand the genuine service that psychiatrists have provided in their country over many decades. We differentiate between psychiatrists and psychologists. Psychology is a branch of arts. Psychiatry is a branch of medicine. That is, they treat the patient. So that is how psychiatry differs from psychology. No doubt, human rights of PWMI have to be protected at all times. However, it cannot be one-sided. There is an equal and strong need to involve the caregivers in framing mental health policies that are ethically and legally sound and at the same time tailoring to their needs and the ground realities of these developing countries such as poverty, illiteracy, unawareness regarding mental illness, stigma, discrimination, etc. So in view of the new challenges thrown by MHCA, that is Mental Health Care Act 2017, such as mental health capacity assessment, advanced directive, nominated representative, etc. These authors stress regarding the need to actively collaborate with the media, police, NGOs, human rights activists, and police. That is their viewpoint regarding criticism of this Mental Health Care Act 2017. Now we come to some ethical issues. Now, law has its origin in religion and morality, but it is different. When we talk of modern law, we talk of legislation. That is something that is enacted by parliament or the state assemblies. For example, if somebody is say drowning, now morality says that if you know swimming, you should protect that person, but there is no legal duty upon you. So if you choose not to protect that person, you cannot be say it is not illegal nor is it criminal. So you may see the person and you may see the person drowning and you do nothing because you are not legally bound to do anything. So law is different from morality in some cases. Now, ethic is defined as a set of moral principles, especially ones relating to or affirming a specified group, field, or form of conduct. Technically, ethics talk about morality and desirable way of behaving, but may not be binding on an individual. Now, there are professional ethics, as far as all professions have their ethics, computer engineers, doctors, advocates. So there are professional ethics for all professions. However, when it comes to medical ethics, these are essential, not desirable requirements based on which a physician is mandated to act. So they have their Hippocrates oath, and according to that, they are supposed to behave according to the medical ethics. The legal aspects of patient care are determined by country-specific regulations, which in turn are governed by medical ethics. For instance, when an Indian psychiatrist is alleged of wrongdoing, it is determined whether he acted contrary to medical ethics or to the pertaining laws in the country. So ethics are different from say legality. That is how we separate this morality from law. Normally they go side by side, but it is not always. It does not happen because ethics are not legally binding. Thus, the ethical and legal responsibilities of a psychiatrist are intertwined. Now we come to another aspect, that is confidentiality and disclosure. So the patient-physician relationship is bound by the moral and ethical sanctity of confidentiality, more so in mental health, because all the say doctors are supposed to keep identity and other details related to health or disease of their patients confidential. So this Mental Health Care Act gives both the rights, confidentiality, as well as disclosure to the patient himself about the actual problem. So this is one of the fundamental responsibilities of the psychiatrist. In clinical practice, however, in certain situations, the PWMI, that is persons with medical illness, themselves waive of this confidentiality clause. That is, they themselves would not like to protect their privacy. In India, PWMI are mostly accompanied by caregivers. Few PWMI, that is people with mental illness, want their information and diagnosis to be disclosed to such caregivers because it is essential and it can't be secret from all persons. Considering this as implied consent till some time back, because there is less awareness in India about the right to privacy, and even the personal data protection bill, one major legislation is now pending before the parliament, and that will become a law soon after a few months, maybe in the coming winter session itself. So there is less awareness about privacy. So considering this as implied consent till some time back, the disclosure was done in the absence of an explicit written informed consent. Now there is a new legislation of this 2017 and there has been written consent. A typical scenario would be a lady under treatment for psychiatric illness for the previous 10 years suddenly turns up to the treating psychiatrist and discloses that she got married around a month back and now plans to conceive. Now, her spouse also wants to discuss regarding the diagnosis, treatment, and the need for and safety of psychotropics in pregnancy. The spouse may unfortunately use the disclosed information for any purpose, including divorce, and the lady may sue the treating doctor for breaching the confidentiality. There was one interesting case that was related to Mr. X versus ABCD Hospital. It is by this name. The names are not disclosed. This was before the right of information came into force. Case was that the boy and girl were engaged to be married. The boy was suffering from AIDS. He was undergoing some treatment in a hospital. The girl came to know that the boy is suffering from some disease, and she contacted the hospital. And then she came to know that the boy is suffering from AIDS, and the say engagement was broken. And after that, the boy sued the girl as well as the hospital for breach of privacy, because there was no right to information at that time. The Supreme Court agreed. The matter went from trial court to High Court and then to the Supreme Court. The Supreme Court agreed that the girl had obtained that illegally. The information was obtained illegally, and the hospital had given the information illegally, and that was breach of privacy of the boy. But the right to life as well as the right to information of the girl under 19(1)(a) and 21 were superior to the right to privacy, which is an implicit right under Article 21 of the Constitution, and therefore the boy did not get any compensation, and his case was dismissed by the Supreme Court. So that was the case. So there, the Supreme Court held that right to information and the right to life of the girl herself, because otherwise she would have got AIDS herself if she would have got married to that boy, and therefore those two rights were considered more important as compared to the right to privacy of the boy. Hence, as the lady herself wants her information to be, this is another case. Now, in this say imaginary say scenario, as the lady herself wants her information to be shared with her spouse, and the confidentiality clause is going to be being breached, written informed consent would mandatorily be obtained from her, including permission as to how much can be disclosed, and this should be documented in the patient's notes. Otherwise, there could be legal action for breach of privacy. There is another complication, legal complication with it. Such written authorization from the patient may protect the psychiatrist in the court of law. So, if such written authorization is obtained, then that would protect the psychiatrist from breach of privacy allegations. It is interesting to know the socio-demographic variables that determine such disorder. Gupta et al. Conducted a study on limited psychiatric patients. Younger age, female gender, and higher educational status were more significantly associated with the patient's unwillingness to disclose their concerns with others. The authors recommend that these factors may be considered when making ethical decisions. So these are the three factors, that is younger age, female gender, and higher educational status. And in such cases, these factors have to be taken into consideration where it should be kept confidential or disclosed. Now, lack of adequate information regarding forensic patients with mental illness. Now, many a times, forensic evidence is sought under Indian Evidence Act, Section 45, and the advocates are called upon to give, or even the forensic scientists are called upon to give their expert evidence. This is under Section 45. So they can summon the doctors, and the court may obtain expert evidence. Diagnosis is of paramount importance to manage psychiatric patients effectively, which rests on adequate history from significant others, as psychiatrists cannot rely fully on mental status examination. When individuals are admitted involuntarily through honorable courts and prisons into tertiary level public hospitals, there is a lack of adequate history. That means there is a referral from primary health center to secondary, which are bigger hospitals, and tertiary, which are the national level hospital, special hospital, where specialty care is offered. This is more common with those referred from prisons. Attempts are made to discuss with the prison medical officer and caregiver. That is patients in custody, prisons or protection homes. The caregivers are either untraceable or unwilling to discuss. Sometimes they are not available. Also, because of unawareness regarding mental disorders, the only history obtained from the medical officer is of patient being irritable or displaying suicidal threats. That is, if there is some aggressive behavior, violent behavior. So these things are available, and the other details are not available many times. This is not enough to arrive at a diagnosis, and without diagnosis, the correct treatment is not possible most of the time. Thus, the lack of adequate history is a major problem in forensic psychiatric setting. The management of such patients thus is mostly based on inpatient observation. In recent times in India, there is an increased focus on training of judiciary and prison medical officers, which is a welcome step. There is also a dire need to have a judicial policy that mandates caregivers and or family members' presence while referring such individuals to psychiatric hospitals. Now, there is this new legislation, Mental Health Care Act 2017. The procedure has been somewhat streamlined. With this background, a retrospective chart review was conducted on female forensic inpatients. In one study, about 73.9% of the sample was referred from prisons and 26.1% from the honorable courts. In view of the alleged crime, 21.7% of subjects were referred for assessment of fitness to stand trial. Results I have given at the end of this presentation. Majority of them, 30.43%, were charged with the killing of close family members such as husband or child. On retrospective evaluation, approximately half of the study sample had an illness at the time of occurrence of the crime. About 30.4% of the individuals were diagnosed as having psychotic disorders, and 47.8% had a mood disorder. A significant ethical clinical improvement was reported in 83% of patients, which is encouraging. It remains to be seen whether the improvement gained persist in the long term, especially those referred from prison. Also, how such patients fare after discharge from the psychiatric hospital and after release from prisons because of treatment non-adherence and other prognostic factors. So this study focused only on female gender. No male forensic patients fare differently. Two male forensic patients fare differently. So that remains to be studied. Now the legal issues in psychiatric care. There is psychiatrist appearing as an expert in the court of law for say civil or criminal cases. So there is one article that is Psychiatrist in Court, Indian Scenario. The authors discuss the legal aspects of psychiatric care when psychiatrists are summoned as an expert witness. They opine that the psychiatric residents often do not get first-hand exposure to the court proceedings. Again, details are given in reference. Now, psychiatry residents often do not get first-hand exposure to the court proceedings. So the reason for this may be threefold. Firstly, many residents, that is resident doctors, trainee doctors, get trained in general hospital psychiatry units, especially private colleges that are not directly attached to forensic psychiatry units because the courts rely on the government hospitals. They have a peripheral posting of just around 2 to 4 weeks to such centers. That is very small duration of internship, we may say. Second, the residents, being doctors in training, work under the supervision of faculty. Hence, the honorable courts do not consider them competent to give evidence. That is, as far as the evidence of residents or junior residents is concerned, court doesn't give much value to them. Third, the faculty members may not involve them in legal aspects of patient care, believing it is not their responsibility, because it is the responsibility of generally the doctors who are handling those cases. It is their legal responsibility. So, in this author's place of work, which is a tertiary level teaching public hospital, generally hospitals are associated with medical colleges. So the psychiatric residents are routinely involved in legal aspects of patient care, but this doesn't happen in all hospitals. The faculty should make sure that the residents are actually involved in the legal aspect of patient care, such as medical board, discharge committee meetings, certification, etc. Only when they are exposed at this stage of their career, once out of residency, they would be in a position to manage such issues independently. So this is one of the aspects, that is the residents or the junior residents do not have adequate exposure of actual court proceedings. Now the outcome of insanity pleas. Under Indian Penal Code, insanity is a defense, and if we see chapter 4, so that is sections 76 to 106, there are some sections which protect the insanity, and therefore this defense is rightly or wrongly taken by the accused person. Even in civil cases, these persons of unsound mind are considered incompetent to contest, and there is a legal challenge in civil cases whether the person was of sound mind or not when say some things like will that is wasiyatnama were written or not, a testament is valid or not. These types of cases are there. So we consider these civil and criminal cases now. So as far as outcome of insanity plea is there, that is the whether the patient or the person is actually insane or not, how the decision is made. So the psychiatrists appear in honorable courts as an expert witness and give evidence, but are unaware as to what happens next. That is just they get someone and they appear. So there are investigators who are commendable for researching a hitherto undetermined topic in Indian scenario relating to insanity pleas. I have attended many of such webinars related to this from Sherlock Institute of Forensic Science. Related and many doctors have given their interesting presentations on this insanity pleas. If an accused has a proof that he was under treatment prior to the crime, the treating psychiatrist is likely to be summoned. That is, only certificate may not be enough, and the courts have power to summon the psychiatrist also. In 32 out of 67 cases, again the details are given in reference, 47.76%, the treating psychiatrist was asked to appear. The time interval between the visit to a psychiatrist and the subsequent date of crime ranged from 1 to 1800 days, which is alarming. 1800 days is almost say 6 years, which is alarming in the sense that a PWMI, that is person with mental illness, may commit crime immediately following the consultation. More so, if there is a documentary evidence of mental illness, there is a higher chance, that is probability less than 0.01% of acquittal on the grounds of mental illness. So this is a defense, and many a times the defense is taken by the accused that the person is illness, and rather than criminal, he should be treated as patient. That is the plea. Both in those cases where the honorable court did not feel the need for psychiatrist evidence, 24 cases, or in those 6 cases where the psychiatrist opined that there was no mental illness, the accused was not acquitted on the grounds of mental illness. Also, 16 out of 56 accused, that is 28.57%, who had mental illness as per psychiatrist opinion, were acquitted on the grounds of mental illness. That is probability is 0.002. So the 18, that is 17.65% cases out of a total of 102 cases were acquitted on the grounds of mental illness. Now that may be right, it may be wrong, because it remains to be seen in that whether the person was actually insane or whether he became insane after the crime or whether he had a history of this. The Honorable High Court judgment was recently mostly in line with the judgment of the lower court and heavily relied on the documentary evidence of mental illness. Now the facts are determined generally by the lower court, that is the trial court, and the high courts only go into the issues of law rather than issues of fact. The psychiatrist's opinion was an important parameter, which is quite encouraging. The results strongly point towards the need for proper documentation. So this insanity plea is in civil as well as criminal cases. This study pertain to criminal cases. Now the absconding behavior in patients with mental illness. Sometimes they run out of prison or out of the detention home or say protection home. So when persons with mental illness abscond from psychiatric hospitals, especially closed wards, it places an enormous burden on the hospital staff in terms of the legal implication, because their own jobs may be at stake. The absconders may not take care of self and may be at risk of harm to self, others, and property. Though absconding from psychiatric hospitals or nursing homes is quite common, no Indian data are available in the published literature, probably because of the concern that it may reflect negatively onto the staff and hospital administrators. So they keep such things, say, buried under the carpet. So this is an unfortunate event. We did not feel inhibited researching this, as absconding is common in any closed setting, including high secure prisons and general hospitals and psychiatric hospitals worldwide, and in India are no exception. So this is also a common occurrence. It is heartening to note that an article dealing with this important, albeit unaddressed issue is published. Among the inpatients, the absconding behavior was found in 4.5% of the individuals. They were mostly males with a diagnosis of schizophrenia or mood disorder with comorbid substance use disorder, that is a type of drug addiction, with impaired insight and high pursued coercion being the predictors of absconding behavior. And about 22.2% of the 9 absconders committed suicide. It often happens with prisoners. A previous history of self-harm and wandering away from home in those absconded points toward the need to inquire regarding this as part of history taking. Sometimes even the family members don't look after because they think that instead of taking care, it is better that he has run away from home. So they simply forget that person. The study for focused on open wards where PWMI consent for admission. Now this consent is necessary, informed consent, as per the Mental Health Care Act of 2017, and the caregivers who stay are responsible for patient care. It is pertinent to study absconding behavior in the closed ward setting where PWMI are admitted involuntarily, that is through courts and prison, that is without their consent, without caregivers, thus placing more responsibility on the hospital authorities because there is no informed consent, there are no family members, sometimes there are no caregivers also. There is a dire need to employ policies to prevent such incidents by rationalizing pharmacotherapy, adequate use of restraints and seclusions. Sometimes they have to be chained, although guidelines say they should not be chained, but jail go as per the jail manuals, and somebody has become voluntarily aggressive. Even the shock therapy is administered. Sometimes there is, say, person is kept secluded. So adequate use of restraints and seclusions as per guidelines. Then electroconvulsive therapy for say agitated patients. Strengthening for the hospital security by constructively stronger wards with tall walls and fencing, adequate personnel, sophisticated gadgets and alarms, and timely discharge from the hospital, etc. So these are the things that are have to be employed by the say detention in detention ward. It also points to the need for prison mental health services where forensic patients can be managed securely in the prison itself. Now, for patients with severe mental retardation, dementia, and severe and enduring obvious mental illnesses such as severe psychosis who are at risk of absconding behavior, few of psychiatric colleagues as part of informal discussion suggested use of mental bracelets. Now, these are cards that are religiously acceptable with details engraved, that is names, phone numbers, and address of patient and caregiver, so that they can identify if they're runaway. Bands and implants, gadgets, watches, and chips with GPS location device and trackers. These are some advanced technologies. But again, there is problem of ethics in this. However, these need to be used after obtaining written informed consent, but the concerns expressed are cost, need for battery charging, can be thrown away, technology not so advanced for universal application, etc. And besides, moral and legal considerations are there. Other concerns expressed were ethical and legal issues, and stigma, restriction of civil liberties, violation of privacy, infringement to capacity, and practicality, etc. The tattoos is another technique with name, phone, and address of the caregiver seem to be a reasonable option, as those cannot be discarded and may have a fashion statement. The future suggestion being tattoos with radioactive but safe, traceable ink material that can be tracked. So the reference is also given here. However, based on ethical and legal guidelines, this is further discussion before implementation. These are some of the advanced technologies that can be used in case of to curtail this absconding behavior in patients with mental illness. Now, the disability benefit of persons with mental illness. So, disability in mental illness is a state where the patient has shown symptomatic recovery with the available treatment modalities, however, has deficits that lead to significant problems with self-care, interpersonal, social, and occupational functioning, and impaired quality of life that may need aggressive rehabilitation. Balakrishnan et al. Scholarly reviewed various aspects of the rights of persons with disabilities Act 2016. This is the new act which has repeated the previous act of 1995, and there is also Commissioner for Rights of Persons with Disabilities Act 2016. Now the government has enacted this Transgender Act, and they are treated as sexually handicapped persons, and they have been given certain rights, including many rights about which I may take a separate presentation in detail, especially regarding the certification guidelines. They point toward the ambiguity related to screening instruments, resource allocation, and the need for inclusive education. They recommend increased focus and reservation for patients who have a disability due to mental illness and specific learning disorders, and decentralization of the disability certification. For example, certification of severe or profound intellectual disability at the primary health center (PHC) itself, so that this disability can be certified which may be suitability or unsuitability for particular jobs. This would prevent inconvenience to end users, that is, who rely on those certificates. Reduce workload at tertiary level psychiatric centers would be cost effective and less time consuming, and would lead to higher recruitment of mental health professionals, especially qualified psychiatrists and clinical psychologists at PhD itself. So this is not only the recruitment of mental health professionals, but even for patients recruitment, that is, their rehabilitation is also involved in such cases. However, such certification should be done by medical board, mandatorily comprising a qualified psychiatrist and clinical psychologist, and not by other professionals such as, say, pediatricians. Now, with rights come responsibilities. So, an individual has a mental illness, is aware of it, exercises his right to not take treatment, commits a crime, attributes the crime to mental illness, and claims the responsibility for the crime as it was due to the mental illness. This is one typical case of misuse of, say, this chapter 4, that is general defense in Indian Penal Code. An example in the context of disability would be that few patients have insight into their mental illness with intact mental capacity, but exercise their right to refuse treatment. That is, they want, say, freedom from, say, prison on the ground of mental illness, but they deny, they refuse treatment. That is the typical scenario in such cases. Thus, they do not want to take responsibility for getting treated. However, to avail benefits, they claim disability on the grounds of mental illness. How can such an individual exercise his right to refuse treatment, but at the same time claim benefits related to his mental illness? These are many such cases of say, misuse of law, which is an open question. Now, the poverty of our patients may sometimes override our clinical assessment. However, it is the state's responsibility to take care of the financial status of its citizens. Now, in prisons, all the medical expenditure is borne by the state, by the government, by the jail. The psychiatrist should only be concerned about mental illness and the resulting disability. Thus, even a rich person who has a disability due to mental illness should get disability benefits. The disability benefits must be independent of the financial status of persons with mental illness. But it doesn't happen in practice. A limited budget is allocated for disability benefits, and improper certification may prevent benefits to really deserving PWMI. Such individuals should be carefully evaluated. This is of paramount importance in general hospital psychiatry units, where the non-psychiatric medical professionals may not be aware of the real concept of disability due to mental illness. Hence, may fail to understand as to why particular procedure is being followed by the psychiatrist. So we need to educate them regarding the legal intricacies of dealing with persons with mental illness. Lastly, the conclusion. Every PWMI is a potentially medico-legal case unless proved otherwise. However, we need to be fearful but cautious while evaluating and treating them, and be aware of the legal angle, which ultimately boils down to the ethical aspects. So both law as well as morality are involved in this case. It is paramount that the fear of being accused of violation of rights should not prevent us from providing legally sound ethical psychiatric care in the best interest of the PWMI, vis-a-vis responding to the genuine concerns of caregivers, especially parents who bear the brunt of patients' illness. Now, jailers have certain powers. So generally, there is only simple imprisonment or rigorous imprisonment, but sometimes they also keep the patient in isolation, although it is generally only for a limited time, because there are side effects of that also. If a person is kept away, we have all experienced that during this corona lockdown, then compulsorily we were kept at home for 56 days. All approaches to medical ethics, be they empirical, legal, sociological, theological, or philosophical, should aim at being practically useful. Good medical ethics must help inform and guide those who are directly involved in moral issues in medicine and healthcare. This means that above all, good medical ethics is clinically relevant. The need is for balancing idealism with pragmatism of how much is feasible and how much should be attempted. It is important that the medical ethics should not become archaic, impractical laws, but scientifically sound, implementable guidelines taking into consideration the ethos, and this should be periodically updated. So lastly, the references: Government of India website, Ministry of Law and Justice, Mental Health Care Act, I have already made a detailed presentation on that. Secondary references I have not named in detail here. There is this article from Rajshekhar Pipita in Indian Journal of Psychological Medicine, Legal and Ethical Aspects of Mental Health Care. So thank you for giving me an opportunity to make this presentation. Thank you, Dr. Ravindra. Thank you, ISMHSD Holistic Health Foundation India and CKSW for giving me this opportunity to make this presentation. This is my contact information.
Thank you, Virendra Kumarji. It was very insightful session. This occupational health is also a very important aspect. In every occupation, we have this occupational health and risk hazards. And especially, as you rightly pointed out, legal
Yes.
profession and practice, you may have a lot of this moral and ethical dilemmas.
Yes, that is
maybe
there.
Our inside feeling is something else, and our client requirements are something else.
I will tell you one of my experiences. When I appeared for interview in this college, that was in 2005. I was asked a question by the principal of the college, "What is your weakness?" So I told him, "Sir, my weakness is that I am a very quarrelsome person." So the principal was the interviewer. He replied that, "Mr. Thakkar, this is not a weakness. For advocate, this is a very strong point. Only you should direct your anger against the persons against whom you are legally fighting. So if you direct in that direction, you channelize your anger, then it will be an asset. And if you are not quarrelsome, nobody will hire you. So it is considered a positive asset." And that's how I was selected in this college. And since then, I have looked after many legal cases, about 150 court cases, and around 700 RTI cases. Around 92 first, out of them 92 first appeal and 46 cases with State Information Commission, and now I'm the resource person of RTI. There's a Uttarakhand Information Commission Dehradun since 2019. Thank you, sir.
That's really nice, sir. Wonderful reply. Yeah, certain occupations, they like these, they demand these things, otherwise it's, as you rightly pointed out, survival.
Yes, everybody wants aggressive lawyers.
Yeah, rightly pointed out. And you really gave wonderful insights. Hope this will benefit many people, who are becoming, would like to become lawyers, or who, have this always dilemma of how these legal professionals or practice, deal with this kind of moral ethical dilemmas and about their mental health. Because maybe in the profession we might be practicing, but at the end of the day, when we look upon ourselves or retrospect, these things always might be haunting us unless and until we are, we don't take it to heart or something like that. So,
yes, actually, there are certain side effects, and actually, my topic today was not related to mental health of advocates. Maybe I will take that on some other day. And another topic that is very interesting is this Transgender Act 2019. That is a new legislation. Maybe I would cover that also. When my wife also wanted to do LLB, so she asked for my permission on phone. So I asked her question, why when I am LLB, my father is also LLB, why do you want to do LLB? Is that because you want to quarrel with me? So my wife replied that you have done LLB. Have you done LLB to quarrel with me? So I told that yes, you can argue well, take admission in LLB. She also completed LLB.
nice.
Thank you, sir.
Thank you, sir, once again for joining us and sharing your wonderful insights. And we wish you all the success and look forward for more sessions in the future.
Thank you, sir. Thanks to all the participants also. I hope there are any questions. Okay.
Yeah, and if there are any queries, you can unmute yourself and ask quickly. We can take one or two. Otherwise,
If there are any questions.
Sir, there are no questions. Excuse me.
Okay.
There are no questions. You did it so much justice to it. since
Thank
you
you.
are, you are from the law, that every point, every topic was taken. For the last 3 years, I have been studying all this. So I'm very happy with that. Though I am a counselor, so these things are very useful for parents. So that is why I take interest in all this, and beautifully done. There is no, we can say, just uh, nothing wrong about it, whatever I am saying, and that is correct. So if anybody wants to ask questions, can, but sorry, I am just
Thank you.
appreciating. Thank
Thank
you.
you so much.
Thank you.
Thank you so much.
Yeah, thank you, sir. Anyone else would like to share your observations or comments? Feel free to share. And feedback form also has been raised for the session. Kindly fill up the feedback form so that we can move on to next session.
Sir, you are hosting the this, and so surprised such a wonderful person is hosting it. Very nice, sir. Thank you. Your
Thank you,
voice,
ma'am. It's all support of wonderful participants like you and wonderful speakers. Support only we are able to organize the program.
superb speakers.
Yeah. Thank you, ma'am, for your feedback. Dear friends, quickly fill up the feedback form, and we have another speaker who is waiting for us, and we can really get inspired by him. He is a visually challenged person. In spite of that, he is always looking for opportunities to do service to the community, and he also achieved a lot. He is a professional social worker, and also he's a deputy manager in State Bank of India, Bangalore, and he's also achieved a very good position in Rotary International uh, as a assistant governor. In spite of being visual challenged, he supports and helps various initiatives. He is also heading environment chair in Rotary International. He is a great inspiration for all of us. And always, he inspires that disability is not an hindrance or a challenge for anyone to overcome. Dear friends, quickly fill up the feedback form for session 4. And this would be, the next session would be last session. After that, I will resume my session. 2-3 areas are there that we'll cover and we'll conclude so that we can, have our dinner, or otherwise, if your dinner is ready, you can have dinner at the same time and enjoy sessions as well. And this Sunday, we will be not having conference, as you all know, daily 6 to 8 p.m. We have international webinar series, and this Sunday, every Sunday, we will have international conference. Instead of that, we are having this workshop on cyber security and internet safety on this Sunday. So it will be a full day, mostly a full day workshop from 11 to 6. So registration forms will be available from tomorrow onwards. You can register. It will be very useful. In fact, everyone must attend rather than should attend, because it is very useful for everyone. Because in the presence of online world, we are connected with everyone, and security, privacy, confidentiality always poses a threat. So we will look in various aspects of internet safety, online safety, and cyber security. What are the various issues and challenges, and what are good practices? All these things, and it's completely free, as all the sessions, all the days. It's entirely free, so you can keep joining daily 6 to 8, and on Sundays 11 to 5 to 6. And you can gain wonderful insights. If you are an expert, subject expert in your domain, you are invited to join us as speakers, and you can contribute to the knowledge sharing sessions. Entire platform is free. This is commemorated as part of Azadi Ka Amrit Mahotsav celebrations, and also with the United Nations, theme agenda set as no one leaving behind. That's why entire platform, we have kept it open for everyone, easily accessible and affordable. That's why, because these are daily sessions, and if we keep something that may not be feasible, affordable for everyone. So that's the reason, all sessions, all days, it is free. So don't think otherwise, free means, it's not always. But we have very good, quality content that is coming up, and we have wonderful speakers, and especially our participants also, they spend their good, valuable time with us. So keep gaining this knowledge till August 2023. We have this wonderful opportunity, everyone. So everyone feel free that this is our platform, and come forward and utilize these opportunities, and also gain immense knowledge. And along with it, as a token of gratitude, everyone is offered a certificate for presenters and participate. And there is also one special certificate that will be given, that is part of Azadi Ka Amrit Mahotsav. So a special certificate will be given to all, which is a certificate of appreciation for being part of our Azadi Ka Amrit Mahotsav celebrations. So that will be a bonus certificate for everyone, for everyone, presenters, participants and collaborators, everyone. So let's utilize this wonderful opportunity for presentations. Then we'll move on to our next speaker for the day. Hope everyone has filled the feedback form. So next we have with us, as already introduced, Mr. Nagaraj. Nagaraj ji, you can unmute yourself, start your video, and your presentation as well.
Am I audible, sir?
Yes, sir.
Yes, sir. So, thank you, Ravindra, sir, for this wonderful opportunity, first of all. And good evening, everybody. And happy Monday evening. So, it will become a special evening for all of us, as this month October is going to be ending, and this is a special month for us, that is Mental Health Month. And I think we celebrated even Mental Health Day also, October 10th. And this time I would like to give my gratitude to our Vallabhai Patel. Today is his birthday. We're celebrating Unity Day, that is Run for Unity. And with that, I will start my presentation. I'll be discussing with you about three important topics. One is about basically about mental health and Persons with Disability Act, National Mental Health Act, and mental health sector in banking sector, mental health in banking sector. So these are all very important issues to be discussed. So that is why. So we'll all learn from each other about so many things. So chapter 3 of Persons with Disability Act 2016, Rights of Persons with Disability Act, speaks about the health. That is in chapter 25, section 25 speaks about healthcare, which tells that persons with disabilities to be provided free, affordable, accessible health facility. It should be available to everybody, for which we need to do the study, diagnosis, prevention, treatment, investigation, and we have to concentrate on providing a quality physical and mental health to everybody. So mental health prevention and treatment, for which we need to give training to the staff members. We need to create awareness about the mental health throughout the society, throughout the country, throughout the world. And mental health, for that, prenatal, postnatal care service is very, very important. And the nodal agency to provide mental health services, All India Institute of Mental Health Services in New Delhi and National Institute of Mental Health and Neurosciences, Bangalore, which is and so many other institutions working everywhere in all the states and districts, which are providing mental health. And we have to promote mental health facility in media, in newspaper, in radio, in books. So you all can write articles, books about mental health issues. So that is why we should learn what is basically about mental health. So everybody is having mind. Without mind, nobody can live. So it is a cognitive, affective, psychomotor behavior. It's our psychosocial well-being, which influences our coping mechanism. It is about thoughts, actions, feelings. So all these things comes under our behavior, our character, and it also determines how an individual handle is stress, how the interpersonal relationship is there, how the person adjusts to the environment, to the society, to the family, to the workplace, and how we are achieving, how we are doing day-to-day work. So that is all our feelings, that is all our thinking. We get so many things, thoughts like today I'm here, but I'm still in Hyderabad. So I'm in Bangalore, even though I'm in Hyderabad. So we enjoy our life, and we always have a creativity, innovativeness. So balance between the life activities. So balance with our efforts. Always we put a lot of efforts to achieve our success, our goals. A lot of students are there. We all have resilience. So response to the stimulus. So then we have to look out our positive mental health. So that includes all the feelings, how we concentrate, how we behave, how we control our life. So a lot of things will come in our mind. We cannot talk everything, whatever comes to our mind. So many times our mind tells, I love you. But indirectly, we cannot tell I love you. They will hit to our face. So that is why, so how we do the decision, how we cope with the life, how we handle the challenges, how we handle the stresses, because stress is a major problem everybody faces. So how we function physically and mentally. So not only mental health is important, even physical health is also important. So everything is important, and how we adjust to the society, how we adjust to the life, how we handle the situations, how we take decisions, and how we enjoy the life. Everybody is having difficulties, but everybody will swallow their difficulties, and they will be all laughing because they don't want to show. So we always should have a quality of life. We always should have a life which is very strong. And the theme of this year's mental health is making mental health a better place, a healthier, happy life. And we should always have it's a global priority. Mental health is a global priority. That is why we should look out the mental health type, that is split personality. You all watched the movie called Aptamitra in Kannada, or Chandramukhi, and so many movies. They're having mental split personality. That is called as psychosis. Psychosis means schizophrenia, bipolar disorders, and so many other mental problems. And we also have a neurosis such as phobia, OCD, that is obsessive compulsive disorders, hysteria, and so many other disorders comes. And we also have psychosomatic disorders like BP, sugar, cancer, so many disorders, which makes even mental health also affected. So that is why mind is having a connection with the body. So for body to breathe, we need a good food, we need a good exercise, we need a good sleep and rest, we need to do the physical exercise, and we should also have a positive mental life. And not only that, mental health means a superstitious belief, the stigma attached. So that is why we should always concentrate on the life. We should have a good memory. We should have a good belief in the life. We should have a good concentration, good consciousness, that is subconscious, conscious, reconsciousness, unconsciousness. All these things are there. So many goes to coma for so many days because of the accidents. While come out from that, it takes lots of days. Lot of treatments are provided to the people. So that is why you are a psychiatrist or a psychologist or a social worker or a nurse or a doctor. It's a multidisciplinary approach. You have to study, diagnose, provide treatment, and do the counseling, therapies, and ECT, that is electroconvulsive therapy, medication, and adjusting to the life, giving confidence, giving motivation. So family therapy, psychosocial therapy, so relaxation therapy, music therapy. So that is why all these things, why these mental disorders happens, because of the stress, because of the depression, because of the abuse, because of the negligence, because of the social disadvantages, because of the poverty, because of the financial problem, because of the family history. So when you see the illness is a major symptom for us. So depression and anxiety are the major problem, emotional issues. So all these things are issues, health issues, financial issues. So these things when we look after, so family support as a social worker or a psychiatrist or a psychologist, we have to do confidence building, healthcare, psychosocial support, and we should always we should see the nutrition is very important. So because of the malnutrition only all these problems happens, because of the genes sometimes the problem happens, because of the family issues these problems happens. That is why prevention is better than cure. We have to assess, study, diagnose, rehabilitate, that is restore back a person into the normal life, improve the condition. We should educate. That is why law is there, support system is there. Mental health is very, very important. We have to give a good ability. We should make him as a normal person. We should treat him as a human being. We should, see the response according to the stimulus. We should cope with the disease, and we should always see the theory which spoken by Sigmund Freud, analyze the mind. So that is why we have to give targets. We should make them to achieve the targets. We should ask them to perform their roles. We should make them to do the activities. We should do the SWOT analysis, that is strength, weakness, opportunities, and threats. All this everybody is having. So that is why we should change the attitude of the people, behavior of the people, so that they will lead a very happy life. They don't feel I am mentally ill. They don't feel I am mentally affected. So because everybody gets a dream, I want to fulfill my dream. So my dream is to become a good social worker. It's happening through Rotary or in the bank or wherever. So that is why we have three important acts passed for the mental health. One is Persons with Disability Act came in 1995, which Dr. Virendra sir was talking about all the chapters. It says protection of rights, full participation, equal opportunities, and bringing the person into the mainstream of the society. Then we got National Mental Health Act in 1987, which spoke about promoting mental health service, training, service and research and education. And then in 2017, April 7th, we got one more act called Mental Health Care Act that came in May 20. This earlier act came in May 22nd April 1987, and the second act came in April 7, 2017. So this law was enacted to consolidate, to provide treatment and care for the mentally ill persons, and to make a better solutions for the problem, provisions for the mental health persons, give respect to the mentally ill persons, providing mental health as an affair of a matter to conduct incidents of the mental health, providing education. And Mental Health Act basically came because to improve their condition, to understand their issues, to help them. So that is why section 309 of IPC, that is Indian Penal Code, says, so discriminating mentally ill persons or attempting suiciding them, exploiting them is a punishable offense for which they have to pay lakhs together penalty and they should go to jail. It's an offense. So that is why we have to provide a very good quality mental health care, mental health service, and to protect them, to promote them and fulfill all their rights to the persons. So that is why Act number 10. And the act which is speaking in the 2017 enacted. So it says clinical psychologist, psychiatrist or a social worker, psychiatric social worker as a multidisciplinary professional who plays a matter of mental health, which has a lot of chapters, which I'm not going to tell in details, but in briefly I will tell you that chapter 1 speaks about adoption of Mental Health Act, that speaks about Convention on the Rights of Persons with Disabilities, which came in 2008, and all the countries have ratified that. And it said by 2030, they all should follow this right and abide by this right. And sustainable development to provide care and protection to the mentally ill and physically ill persons. And chapter 2 speaks about mental illness capacity to make a mental health care and a treatment decision a very effective and active one. And chapter 3 speaks about advancement of directives. That means we should give a good care, quality care for the mental ill person. And chapter 4 speaks about nominations, representatives for the mental illness. That means we are the nominated, they have nominated state and central board, central executive and advisory board for the mentally ill persons. So chapters 5 speaks about rights of persons with mental illness. So they have got a right to education, right to health, right to livelihood, right to protection, right to development, right to participation. And the next chapter 6 speaks about duties for appropriate government. It's a government's responsibility to take care of the mentally ill persons, or a mentally retarded person, or a physically challenged person. And next chapter 7 speaks about central authority for mental health. And the chapter 8 speaks about state authority for mental health, who have to provide all the facilities for the mentally ill persons. And chapter 9 speaks about financial accounts and audits for the mentally ill persons. That means loan facility and financial facility for the parents and the caregivers and the patients to be provided. And the next 10 chapter speaks about establishment of mentally health institutions, either government or private or locally, Anganwadis, Balwadis, wherever you have to set up mental health facilities, because in cities you will come to know mental health issues. In rural area, it is very difficult. So next chapter speaks about disaster management. That means because of earthquake, because of volcanoes, a lot of people will affect with the mental health. So that is why the next chapter 10 speaks about review of the mental health services. To the we have to review once in a while, and we have to provide new facilities. And 11th chapter speaks about admission, treatment, and all the tests and the discharge. So all these facilities, because sometimes people doesn't look after them. So they're really great people who looks after mentally ill persons. Sometimes we will also act like a mentally ill persons. Not at all. We are also human beings. Everybody, because of the stress, it happens. Then next is responsibilities of NGOs. Chapter 12 speaks about non-governmental organizations. They are also supposed to provide health education, training, rehabilitation, and research about mental health. Then chapter 13 speaks about restructuring of the mental health. That is, it is not covered. So whatever is not covered, a separate facility is being provided. Then chapter 14 speaks about penalties and offenses. Those who do violations, for them, they will be punished. And the last chapter speaks about miscellaneous services, that is providing health, education, jobs, training, research, and whatever is left out, and multiple disability. I have a mental disability and a blindness, so that is a double disability. So you have to take care of the double issues. So that means both are essential to look after, and that is why the final chapter speaks about providing residential care, hostel facility for the mentally ill persons, boarding, lodging facility, those who cannot get the facility. Then I will come to the next topic, that is mental health in banking sector. I'm a deputy manager in State Bank of India. And I want to tell you, in the bank, we all suffer from one problem, that is poor mental health. Not only in India, even in the abroad also, everywhere. That is why this mental health problem is happening is because earlier days, we are having a lot of things. And I request, first of all, everybody to open an account in any bank and take the loan and achieve your targets, and definitely will become a very great personalities. So nowadays, a lot of new technologies happening, a lot of new technologies are revolutionizing in all walks of life. That is why it is coupled with liberalization, privatization, and globalization announced by former Prime Minister, ex-Prime Minister P.V. Narasimha Rao, when Chidambaram was finance minister. So that time, Manmohan Singh was a finance minister, they announced. So because of this privatization, globalization, and all these things, a lot of new changes have been taken place. Computerization has happened. Many people doesn't know how to use computer. That's why many quit the job. So that is why in all walks of life, in the banking sector nowadays, we have got a lot of targets, budgets, campaigns, so many things to achieve. Very difficult to do all these things. We are having no exemptions. We all have this poor mental health. That is why we need the support of you people like psychiatrists, psychologists, social workers, everybody, because even I did my MSW and I also know the difficulty of the persons and how to take care of these people. So that is why in all walks of life, because of the government, private, lot of competitions, poor mental health is a major issue, because we are having high anxiety, high depression, high phobias, and banks have going through enormous types of things, organizational structure, new managers coming, new things they will tell. And today they will ask me to stay back in the bank till 9 o'clock in the night. I am living away from family and working throughout for developing good service to the people. So this way, so whatever the new technologies are happening, the organizational structural operations are happening, so marketing pressures are happening. So we need to understand the working condition. So a lot of people having a daily life is different. So for example, I will give you one example. I'm always working in bank. Once I went to check train and they said there where you are working. So I said, I am a manager in the bank. Then they said, this sound is coming, that is chukubuku, chukubuku. So they were telling checkbook, because I should always think about checkbook. Because how many a lot of complaints are coming, a lot of frauds are happening in the bank, a lot of people says, I lost a lot of money, I told my OTP, I told my CVV, I told my card number. Don't tell all these things. People will tell and they will come and complain. And some people, staff will face the problem of competition is very much there, because some bank is achieving a lot of business and we are not able to do. So we have to provide customer effective services. Prompt customer service is very, very important. So we work with a lot of pressures. We work with a lot of digitalization, and the platform is marketing pressure is very much there. Targets are always there. Role conflict is always there. And my wife always scold me, you're not coming home. You're always staying in bank. You tell that the bank is your second home. So that is why what we do, so a lot of stress. So recently, I think last week, we got in a paper, one of the women in Canara Bank, she attempted suicide because she applied leave and management pressurized her and they scolded bad words. Then she couldn't tolerate this. So she went home and she suicided herself. So like this, a lot of people are attempting suicide. And we have got a lot of new roles, a lot of promotions, a lot of transfers, a lot of rotation of jobs. And so many people are, we are pressurized to implement all the government schemes like Pradhan Mantri Jan Dhan Yojana, Pradhan Mantri Suraksha Bima Yojana, pension schemes, so many insurance schemes. So bank is even doing a lot of insurance things. So lot of duties are happening. Even sometimes they will assign us election duty. So that time very difficult to bear. Very traveling also distance is very long. So that is why, because of this law, rapid changes, rapid policy changes, because of the banks' creativity, innovativeness, we have to utilize. So foreign people are coming, payment banks are coming, a lot of new banks are coming, a lot of new digital accounts are opening, a lot of cooperatives are coming. So we are doing a lot of policies like taking a lot of time to give loans. So some people will come to your home and they will deliver the home loan itself to your home, and they will put a lot of interest that nobody knows, but people want a service very fast. So that is why this kind of changes, whatever has happened, so banking got affected in a very big way. So that is why what I want to tell all of you is, so look after, so treat everybody as a human beings, use your knowledge, skill, experience, profession, everything. So because of high level stress, more than 2/3 of the people are quitting the jobs. They're not able to work because seniors are pressurizing a lot everywhere. So financial targets are more. And we also see that people are, coming with alcohol. A lot of people even attempting suicides. A lot of people come with absenteeism because of the health issues. So a lot of people, shift their jobs. Wife will be somewhere, husband will be somewhere, children will be somewhere, like military people. So this way we have to improve. A lot of research has to done, a lot of education has to done, a lot of trainings needs to be done. So that is why every 2 out of 5 executives that describes that bank's job is extremely stressful, bank job is extremely anxious, and we have to contribute a lot to the customer, because we will get different types of customers. Some customers are very soft, some customers are very hard, some first customers are scolding us, some customers are taking the work very nicely. So this way, performance incentives, quality of the work, productivity of the employees, and overall performance of the work and employees, and the staff turnover and absenteeism. So because of all these problems, these issues are happening. Anxiety, depression. You see our banking people have the problem of headache, because we're always sitting in front of computer and watching you all. And not only that, we get a lot of backache. So because we are sitting, we're not able to go here and there because a lot of customers are coming. We get a lot of BP, sugar, blood pressure, and all these things. So this way, so very big competition is, one is excessive demand, that is problematic customers come sometimes. Relationship with the co-workers is very, very different sometimes. Then family relationship will be very, very different. Work-life balance, very difficult to maintain. Then risk is very much there. Risk means lot of risks are there. So that means, capital risk, organizational risk, so many risks are there. So what we should do to avoid all these things? One is we have to set up a realistic goal, and we should work for the goal and handle things very carefully and engage. That's why every day we have to ask everybody to do yoga. I am doing yoga in the Art of Living since 2012. Every day without leaving one day I'm practicing. Because of that, I'm very active and very enthusiastic, very much energetic. So this way, relaxation is very, very important. Using our energy is very important. Then secondly, engage your employees in physical activities like yoga, dhyana, meditation, and all these things. And you should sit, stand, walk around, turn around, move around. So it will give us strength. It will give us capacity, dance. So definitely we will be very happy. Then reward your employees for the good work they do, like giving a pension, giving extra amount, giving OT, giving taking them outside. Like this, we have to take employees outside, like trips you should take to celebrate, make them to celebrate, and make them to sing, make them to dance, make them to play drama. So this helps us to release our stress and maintain work-life balance. So for example, I will tell you, family things, whatever anger I get in the office, I show it with my wife. Wife will get angry, I'll show it in the office. It should not be there. So office work we should forget in office. So homework we should forget in home. So like that, we should do wherever things are there itself. That is why counseling plays very, very important to do the crisis intervention and interaction, talking. So for example, have you anybody, you are all working means, have you anybody said good morning to your security? Is also very important. No, should tell good morning. You will feel very happy. You should tell good morning to your canteen person. You will also feel very happy. And you should always, whenever you get stressed, you drink enough water. Every day I carry a big bottle of water. Every hour I drink 1 glass of water so that I will be very happy. So be a smart worker than a hard worker. So smart worker means SMART, that is specific, measurable, accurate, reliable, and tangible work is very, very important. And we should teach discipline, and we should teach a good behavior, and we should avoid the unhealthy habits, especially in the banks and outside, like smoking, drinking, and all the nonsense things. And we should always make them to do social work like CSR. Every bank or every industry have a corporate social responsibilities. Whatever share is there, we should develop the infrastructure. For example, I have a bank. Around my bank, I should develop a school. I should develop a hospital. I should develop a canteen. I should develop so many things like this. A play home for the children, crush like that. So everybody will feel happy. And we should make our employees to develop the natural attitude, like planting trees and love for the nature. This is very important. So we have to develop the stop aptitude. Like any customer come with very anger, I should follow this. Yes means stop. That means I should listen to whatever he's talking. Then T means take a deep breath. Then observe what is happening. We should look around and observe. So that is why observation, appearance, behavior is very, very important. Then proceed whatever possible we can do. And we should give motivation to the employees. Like, for example, in Deepavali, we got some bonus or some facility, like in Dasara, we got Kadlepuri. So like that, some things you should develop. We should develop the knowledge, skills, attitudes, and put in practice whatever you learn. And we should empower all the employees. So that is where we should make everywhere positive mental attitude, positive mental health, feeling happy, feeling harmony, feeling pretty good, and doing jokes and enjoying the life. And we should make them always working is also difficult. You should go out sometime a little 5 minutes, then come inside, so that you will be very happy to work. You can able to attend the customer very nicely. So this way, this topic, I think whatever the knowledge I have provided, you kindly practice it, you learn. That is what I always tell in each session. When you spend knowledge, it will grow. When you spend money, it will go. Keep on spending your knowledge. Whatever you know, you teach everybody, so that you will also become educated, and everybody will become a learned person. So that way, so I thank Ravindra sir and Mary Florence madam and everybody who are there here to celebrate this wonderful mental health day on this auspicious occasion. I thank the speaker for this wonderful opportunity which you have provided to me to present. Even though I think whatever mistakes I made because of the work pressure in the bank, because of the month end, I could do to the best of my knowledge whatever possible. Thank you, sir.
Thank you, Nagarajji. It was a very insightful session. You gave a good record, various acts, and especially the banking. There is a huge competition, as you rightly pointed out, a lot of stress involved. As I was also mentioning, it's occupational health in every occupation is also very important, and often it is an ignored area. So every occupation has its own challenges and issues that needs to be addressed, and mental health issues are also, some of them are similar and some of them are different. So we need to address them, and especially you have rightly pointed out, as the challenges, additional challenges persons with difficulties face. So it was very insightful, and thank you once again for joining us, and we wish you all the success and look forward for more sessions.
Thank you, sir. Any questions? I'm ready to take.
Yeah, participants, if you have any queries, we can quickly take. You can unmute yourself and share, and we'll move on to next session as well. there are no queries, then we are launching.
I would like to tell one small thing that especially children nowadays, they're addicted to mobile and TV a lot. So kindly give them books so that they will be very much active and they will be able to study well and come up in their life. So,
Yeah.
yes, sir.
Thank you. Yeah, it is also very important now that we cannot get away with our gadgets and other things because we are accessing, we are using it for multiple purposes, but limiting screen time and rationing the time we are spending online, and that's is very important because our health is also important. A lot of people are getting blind, and especially eye related issues are popping up, and because of that various other health issues are also coming up. So it is very important, and especially teachers are facing a lot of issues because children are back to schools, and they are also not feeling comfortable because they were enjoying at their space and freedom at home, and now coming back attending classes, and the whole different set of challenges, and more than students, especially parents are facing, because a lot of pressure that children need to adjust back to their normal settings, and parents are also struggling a lot to ensure that things are back to normal. And this year it has been quite complex or complicated because last 2 years it was lost, uh, bringing back everything on track. So it is very important. Maybe this Sunday we are having exclusive workshop, which also focuses on this online internet safety, cyber security, and various aspects. If possible, we will also cover this gadget addiction, de-addiction, if time permits, or if appropriate resource person is available. So thank you once again, Nagaraji, for joining us.
Thank you, sir. Thank you.
Dear participants, quickly fill up the feedback form for this session, and we will resume the next session and we'll conclude. So quickly fill up the feedback form so that we can close it and move on for the final session. Dear friends, quickly fill up the feedback form. So we will be moving on to our next session. We have with us Dr. Chandrakala Diyali ma'am. She is a senior assistant professor with Amity University, and she has MPhil PhD in social work, and she has completed research project funded by National Commission for Women, and also she is brought out a book also, uh, first of its kind, National Commission for Women in Sikkim, a situational analysis of women and girls in Sikkim, and the same book was published by NCW. And she has, to her credit, various academic and research interests, including geriatric social work, child and women rights, counseling, gender studies, and also has many research publications in reputed national and international journals. And she is also executive member of ACAP from India and also life member of MAPSWI. And she worked at various positions also earlier. So we welcome you, ma'am, for your session on mental health problems among youth and towards sustainable solutions. Hello. Good evening, ma'am. No, right now you can present. You are the last speaker, ma'am. Actually, we were the thought of concluding. I made you co-host and also completed your introduction. You can start now.
Yeah, good evening to everyone. Good evening, Ravindra sir. Today, as we are celebrating International uh, Mental Health and Sustainable Development, I mean, it's just we are trying to now. Good evening to everyone. Uh, Today's international conference topic is international. What is that? International seminar is on mental health and sustainable development. So my presentation is going to be very short because there are a lot of, I have a lot of preoccupancy. So I have not got the chance to hear whatever has been presented by respected other resource persons, but nevertheless, they must have been very good, and you all participants must have been able to understand many aspects of mental health issues. So today, my topic is mental health problem among youth and towards sustainable solution. As far as mental health issues are concerned, like, and among youth. So as per National Youth Policy 2003, we define the youth as, it's in a whole lifespan. Youth are people, the population who are above the age of 13 and below the age of 35 years in India, as per National Youth Policy 2003. So now these age group, 13 to 35, so it includes even children group, the adolescent group, and adulthood. There are three, bifurcation in adulthood. So it's a kind of first, first category of youth, right? A first category of adult. That means pre-adulthood, right? So in that case, this is the age group which is very vibrant, where our hormone is at the peak, hormone bursting, and many changes physically, psychologically, socially. There are many changes that's occurring, right, inside of us and outside too. And this is a kind of this is the age group where there is a lot of transition also. 13, that means you touch upon the teen age is like, it's quite and then that's adolescent age, right? So we are having a lot of changes, physical changes, psychological changes. So and there are a lot of confusion too, because the society outside, in the family, we are said whatever important discussions are being, discussed in the family, we are told to move out. Something very sensitive issues, we are told to just go out because we are young. That's what our parents state, that okay, we are too young to listen to all this, and you're too young to get involved in all this kind of serious discussion. You go and study. And then when we move out of our house, we are looked up, okay? The teachers, the society in and around community, they tell us that you have grown now, you should be responsible, you should be a person who's very decisive. So there's a lot of confusion, right? And then today's world, when we are already faced with a lot of conflicts, there are a lot of uncertainty, even in terms of, life is being alive itself is a big gift. So forget about other uncertainty. People are dying of, something or the other, such uncertain deaths and all people are facing with. Today the person is all right, tomorrow, we might hear, oh, this person is no more because he's got a heart attack, stroke, this, that, and that's happening even among the youth. That's 13 to 35 years age. And why? Is because of the mm, because of a lot of challenges, because when things are not right, that means something in the society is not going right. That means there is lack of calmness, or there is lack of sanctity in the family, among the family members, in the family environment, outside of the family environment, in the professional arena. So there are many things, inside of you and outside of you are always in conflict, right? And things are not going right. So in that case, now, what are the causes of mental health issues? Let us just find it out. So there are many causes of mental health problems among the youth, and major ones are physical, emotional, and social changes. And that means there are physical, that means I've already discussed, there are a lot of changes inside of us, outside of us, for men, male, or both female and male. And then emotional changes, because there are a lot of conflicting statement from people. Some family members, they tell us, you are still young. Outside of us, they expect us to behave in a very matured way. Sometimes your own mother would say, oh, you are grown up now, you should be able to handle this much, don't bother me. So a lot of confusion, a lot of conflicts are there, and along with that, a lot of challenges we are facing, right? So but mental health issues have been very rampantly increasing among the youth, because of many reasons. Because see, first of all, is if we take a very broad kind of outlook of it, that means it's because of the population rise. Exponent population increase, that's causing us to have a lot of kind of challenges in terms of getting an access to resources, getting an access to opportunities, getting an access to a lot of other benefits and all. There are a lot of kind of competition, cutthroat competition is there, even in the schools, to kind of to help them cope up. There is the schools and all, they are not but very recently, yes, of course, counselor and all have been kind of kept there in the schools, in the colleges and all. And very soon, yeah, after let us be very positive, after our council for social work is going to come up, then very soon government is going to recruit a lot of counselor in the school, in the schools setup also. And they have already started, because there are a lot of because post COVID, obviously post pandemic, things have become very uncertain. People children are facing a lot of problem, personal and their family problem, the studies problem, coping up with the challenges, all that. So let us see overall what all are the challenges. So causes of mental health problems. So first one is childhood abuse or trauma or neglect. That means the child is not being properly brought up. The rights of the children, forget about rights of the children, they are not being treated well, you know, in the sense, this mother, working mother, yes, she's an empowered mother, but it has impacted the family, system and functioning so much. Sometimes I can very confidently say negatively too, because a maid, grandmother, or other members of the family cannot kind of substitute, the mother, completely, because there are always emotional need of a child which goes unnoticed, unheard, that is where the conflict starts, something that is, if you remember Freudian theory, I mean, unmet needs, because of unmet needs, a lot of conflicts uh, gets developed in the personality of a child, right? And if that child faces any kind of abuse, trauma, or neglect, it could be physical abuse, it could be sexual abuse, it could be any kind of the verbal abuse and all that, because parents are very, very busy these days. They have to live up to the expectation of office demand and all that, so they don't have a very calm and cool head these days. And when they get back home, they want to just relax, and amidst of that, children coming with all of their issues and all, the parents cannot do justice to the child, right? So that's where the child feels neglected. Another is social isolation or loneliness. That means I have already told you, as children, they are left alone during the whole day. The mother leaves. Yes, every mother. Okay, every mother has to, start for the office and in the early morning, and it is not only, I mean, I myself being a working woman, working mother, so I know, I mean, we prepare them good food, everything, but if the warmth is not there during the daytime, whole 8 to 9 or 10 hours, the children are left on their own, you know. So their energies are not being channelized in the right or positive way. So obviously that they are left to feel lonely, they are left to feel isolated, they are left to feel neglected, right? So it is very, very important that we kind of engage the mind of young children, because they are like sponge. Their mind is like sponge, their brain is like sponge. Whatever get infused, a drop of water, you any number of drop of water you kind of trickle into the sponge, it absorbs, because it is so soft. The same way children's mind also, it is very gentle, it is very, very delicate, so it absorbs. uh, I mean, so whatever, if not being directed in the right positive manner, they are left to kind of self-harm in a now or in a long term. So they learn out of what they are exposed to during the daytime. If they are watching TV, they learn all the languages, all that is being taught through movies or any kind of programs that they are watching. So they will think this is the real life, because there's nobody to interact with. Next is experiencing discrimination and stigma, including racism. Yes, we human beings are so self-centered. We have divided the people on the basis of caste, on the basis of religion, on the basis of so many other cultural, cultural mm, what elements that are there, right? Uh, and above that, if discrimination was not there based on that element, that's okay, fine. But discrimination, the children have to, some section of the children, if they are low caste, if they are coming from certain religious background, if they are coming from certain religious, class background, they have to face stigma, they have to face discrimination, they have to face a lot of trauma, mental, physical, and verbal traumas, mental, physical, traumas, because they are sometimes, kind of abused also, and they are being discriminated in different ways, and they, as a child, they understand very well. So that is where the mental health uh, problem triggers social disadvantage, poverty, or debt. So if the child is coming from a poor household, so obviously poor, then poor household, less income, less knowledge, less education, educated parents, so hence lead to, this vicious circle of, poverty, and I mean, and then so many other problems get involved after that. So next is bereavement. That means if there is any loss, if there is any crisis in the family, so I mean, if there is death of a family, mother, father, or grandmother, somebody, their pets and all. So I mean, that also gives a lot of mental health issues, because if the children are left with pets, their mother and father are working, so they don't know, as if they lose their dogs, or if they lose their pets and all, uh, with whom the child used to spend a lot of hours during the day, and had a very committed relationship with the pet, that leads to a lot of trauma, and a lot of issues, trauma, and a lot of issues in the child, severe or long-term stress, uh, and one crisis adds to the other adds to third one. So that way it is a mixed crisis or stresses that, and moreover, in the schools also, they have to be in competition all the time. They have to face a lot of, a lot of competition. They have to be on their toes, they have to be updated. So if things are not good at home, they will not be able to do that. So they feel incompetent, in comparison to the other child. So hence leads to addition of a lot of stress among the children. And there is comparison among the siblings also, between the siblings also, that leads to a lot of stresses among the, you having a long-term physical health condition. So I've already mentioned in the beginning, that health is to do with, health is to do with all the aspects of health: physical health, emotional health, spiritual health, mental health, and all that, right? Psychological health. But uh, if if there is a psychological problem, it leads to somatic, psychosomatic problem. So if it is somatic, let something not okay, you are ill for a long time, you're suffering with some big disease, if you are facing lot of uh, health issues and all, that leads to lot of stress and anxiety, among the children. So these are the causes of stress. And what could be the best solutions, for children or youth to overcome that issues is, we as parents, the last generation, we have already damaged the Mother Earth. So we've got to let ourselves understand the meaning of sanctity, meaning of happiness. We have to understand meaning of relationships. So all this needs to be understood by us timely, otherwise a big devastation is awaited, right? A big destruction is, we have already destroyed the Mother Earth, and that is what is causing a lot of pain and pressure among the youth today. So next generation, many girls and boys in India, across the world, are voicing, advocating for the for the for better earth, for better living, for for globalization, right? It's not about globalization now, globalization for sanctity, in life, so that we live to enjoy our life, to enjoy small things in life, to enjoy the environment that is being gifted to us, then be in this cutthroat competition always, right? Compete with yourself, be better person than what you were yesterday, but do not kind of bring in a lot of enmity, between your among your siblings, or between friends, among friends, so that there is sanctity in the air, sanctity among the relationship, right? So I have come out with a few solutions. That is, broad is our behavioral change has to occur very, very soon, so that we are less consumeristic. We would go as per the need, not as per the greed. We would recognize, acknowledge, we would accept the the values of environment, nature, and then develop the sense of gratitude among ourselves, and then teach, not only first teach, imbibe the value system to respect our relationship with nature, relationship in the family, relationship among our friends, near and dear ones, and extended family, the whole world. And then teach the next generation the good way of life that is being taught by our father of the nation, to go for self-reliance, to go for, self-reliant village, to go for, what do I call that? To go for, small happiness, well-being of yourself and well-being of all. And whatever we are inventing, whatever we are coming up with, new thought, new writing, new movies, new creativity, whatever art we are coming up with, it should hold a strong meaning to give infuse in lot of our epics, lot of our mythology these days, so that so that our youth would be able to kind of understand the right way to go on the right path. And and then coming to the specific point, make social connections, especially face-to-face, a priority. That means, we have digitalization is good, but it needs to be sustainable. See, we've already just now we were talking, me and Mary ma'am, who's part of the team, we were talking about digitalization, and there in South India they have already introduced 5Gs, and 5Gs is already there in India as well. So now in and across the country now 5G is going to come. But what is the repercussion of having 5G to the nature, in the environment that we have to assess timely, so that timely the Mother Earth is taken care. And it is not only social connection. We say these days, okay, we should stay connected, and then we have a lot of ways to connect: online, virtual connection, offline connections, and all that. But we fail to connect to ourselves, because ourself within us is a soul, right? And soul is so pure that it has a direct connection with the divine, right? Every one of us has divine within ourselves, right? So if we are not connected with ourselves, then somewhere we get lost. And that is what is exactly happening among youth. They are trying to copy the Western culture, Western ways, Western it's okay kind of attitude that needs to change. It's not okay to do wrong thing. It is very, very they need to be taught that it would have wrong impact on their health, in the sense, not forget about physical health. If it is causing causing some problem, it is going to affect, because if your way of life is not correct, somewhere down the line, just a second, it's going to affect you. Close that door, please. So it is connecting with yourself. That means being self-aware. Latch it. Being self-aware is very, very important. And then we have to, and yoga is the best way to connect to ourselves. And yoga does not only happen on the carpet, it happens with your kitchen work too. While you are working with the while you are doing your household chores, that itself is a yoga. You don't have to put a mat and then do rigorous yoga. If you are sitting preparing dishes for your family, that itself is a yoga, right? So you have to first, what I mean to say is, you've got to connect within yourself with the divine. And then once you are connected, there is health is to do with the self, the spirit, your physical health, and then your mental health, right? So it is like a full triangle, right? Triangular perspective I would like to give about defining the health. So first you connect to yourself, and then you connect, then only you'd be able to connect with the divine, and then you'll be able to connect socially. Stay active. We've got to be very active. There should be no day when staying active. If youth are here participating, always, I'll just give you a very, very it might sound very funny, but taking bath, stay activist morning is the best way to get rid of mental health problem, right? If you are physically feeling fresh, then your mental status would be better. If you don't take bath, sometimes you feel very lousy, this, that, and all. Just get rid of that cozy bed, and then come out and take bath during winters and all. I've seen my own students, they say, ma'am, we feel very lethargic to get up in the morning and all. So I suggest them, get up in the morning, take bath, and that's best way to freshen up yourself physically, and then it would enter your mental well-being as well. Talk to someone. That means you should always have a social network, in the sense. And I was watching one movie there, they had referred to having good social network, but those networks should be with good people, having a same line of thinking, something, it is very, very imperative, having a social kind of network with the wrong people would definitely put you into doing wrong, right? Because if you are thinking right, there is opposite way that's coming, opposite ideas that is coming. So somewhere down the line, you are likely to get affected. But if you are strong within yourself, yes, you not be affected, but as a child, you're likely to get affected. So have good social network, in your family. Try to kind of improve, and it is never late to improve our style of living, improve on the way we live, the way the thinking pattern, the feeling, the behavioral change inside, inside your own family and outside of family, in the community, right? Community in the sense everywhere we go to. And so talking to someone, as rightly being said by Mahatma Gandhi, our father of the nation, that burana socho, burana bolo, burana kaho. To my children also I say, mama, it's okay to watch this, so I tell them it's not okay. Today my child had Halloween day, so they were made to paint all blood coming out of their mouth and all. So school is encouraging, so we should give a strong message that then what is this like. And today was another festival that was yesterday, and it prevailed today also, Karwa Chauth and this Chhat Puja and all that. So let us kind of focus on something that is meaningful for our country, and that is what is indigenization, right? So being Indian, we are not supposed to only kind of keep flag in front of our house, or hoist our flag, but the nationalism should be practiced in every seconds of our life. What our children are learning, what the schools are teaching. We are not supposed to copy the West. This Halloween day was never there in our history, right? I don't think so. So it is all being imbibed by the Western culture. So let our children not get such kind of wrong information from the schools, which is one of the very important factor of socialization. So that would lead to a mixed ideas, that is conflicting ideas, that mother is teaching something else and the school is giving a different feedback. So once they are celebrating Diwali, Dashera, Eid, this, that, and all, Christmas in the school, let them understand that these are our culture, these are what we have to practice, these are the messages that is correct for us to imbibe. And then all this Halloween day and all, I don't know how others would feel, but I did not like the concept, because I strictly follow burana socho, burana bolo, and burana dekho, and then children are making all this kind of painting where blood is coming out of their mouth and all. So it's a very conflicting, or very, very opposite message that children are taking home. So eat a brain healthy diet to support strong mental health. These days it's become a fast food culture everywhere. But nowadays, because of how our prime minister is encouraging this startups and also let our startups be more indigenized. Instead of eating Maggie, let them eat this I have seen one program I was watching, and then they had the small idlis, with the kind of ready to make sambar. So that would be very, I was very impressed. Such kind of snacks and all the food habits should be inculcated among the children. And that's what, looking into all that changes, very soon I'll be organizing a workshop on, diet and sustainability, so that's where we when we are talking about indigenization, when we are talking about Indianization, that means in every aspect of our life should reflect that, not only our syllabi, not only our course syllabi, but our every aspect of our life in practice and teaching. It should reflect that we really stand for the nation, we really stand for the nationalism in a real sense. So our food habit also, we have to teach our young children that this is better food. We should let there be, South Indian, instead of Halloween day, let there be food day, healthy food day. Let there be South Indian dish day. Let there be North Indian food, dish day, like that. Some kind of, I would request the authority to really kind of come up with such concept, instead of all this, concepts that would make corrupt the mind of our young generations, who are going to be leaders in days to come, to lead our great nation, India. Don't skimp on sleep. So it is very imperative that these days it's like even small children are multitasking. They want to do at the same time, they want to learn music, they want to do swimming, they want to do this thing, and that's good. That's good. You should become multi-talented and all that, but you tell your parents that I require good 8 to 9 hours of sleep, because if your mind is relaxed, then only it would get recharged to function better than the last day, right? So that is the right of the children. So that should not be snatched away from the children. So these are what I feel. At the broader sense, I've already told you that our behavior has to change, our attitude has to change, our feelings and pattern of thinking should be changed. Then hence, once these are changed, our behavior would change, and behavior very urgently we need to change our consumeristic, hyper-consumerism from the to the need-based, consumption. And we should develop the sense of gratitude for our nature. We should very urgently, I request, I would use this platform to request the Prime Minister of India to, if we can stop, if we can demonetize overnight, let us get rid of the non-biodegradable material like plastic overnight. That would be, the great day for this nation, who respect and revere and call the country Ma. So let us revere our Ma in a true sense, and let us all youth come, with all those, put a strong foot ahead and say that yes, we are here for the purpose, and for the right purpose, to do right, to think right, and put the right thinking into right action. With this, I stop my presentation. Thank you to you, Ravindra sir, for having given this opportunity alongside with many other dignitaries. Thank you to Miss Mary for having communicated to Ravindra sir where I could not join. Thank you once again. Thank you, sir. Over to you, sir.
Thank you, ma'am. It was a very enlightening session. You throw light on various aspects, especially the kind of issues that are being faced by adolescents and children. Thank you once again for joining us and sharing your wonderful session and solutions also for various things. We thank you and congratulate you, and we wish you all the success for your future endeavors and look forward for more sessions in future, ma'am. So, dear friends, we already have exceeded time, so we will resume our other aspects tomorrow. Tomorrow also you can join from 6 o'clock and you will get a different certificate for tomorrow, so no need to worry. So we will resume the different aspects of mental health tomorrow. And thank you everyone for joining us. Kindly fill up the feedback form for this session, and after this we will have overall feedback form, and you can leave the platform. So before that, let me share the feedback form. After this we'll have vote of thanks, then we'll sharing you overall feedback form. Now the feedback form has been raised. Quickly fill up the feedback form for session 6. That was last session. Dear friends, quickly fill up the feedback form. I invite Manasa to be prepared for the vote of thanks after you fill up the feedback form. Dear friends, quickly fill up the feedback form for session 6, that is last session.
Yeah. Draw symbol.
Now I invite Manasa to propose vote of thanks.
So, very good evening to one and all. I, Manasa, thank Dr. Ravindran sir for giving me this wonderful opportunity to propose a vote of thanks and also to express my gratitude. First of all, we thank Dr. Ravindran sir, moderator and coordinator, and his team, Sri Holistic Health Foundation India, Sri Research Institute, Center for Arts, Sciences and Wellbeing, for giving us a wonderful opportunity to gain knowledge and also organizing, inviting, conducting international seminar and conferences and also webinar series in an excellent and well organized manner. Enjoy insights of international seminar today. Without their efforts, this couldn't have been possible. And I would like to thank all our valuable session speakers of the international seminar on mental health today. Firstly, Dr. Ravindra sir has been enlightened us regarding the World Mental Health Day, and also as per the sir observations, yes, COVID-19 is such a pandemic situation. It impacts on everyone's mental health like anything, and not only that, it's been a global priority. And as per World Health Organization, it's really launches many training and designs to improve mental health. It's been really a wonderful session, sir. We have learned many things from that. Thank you, sir. And the very next session speaker, Christina ma'am. As per ma'am observations, health is complete combination of physical and mental health, and also the role of therapies and the factors which really affects on mental health and poverty healthcare and public health discrimination on mental health. It's been really a wonderful session, ma'am. Thank you. And the very next session speaker, Mary ma'am, regarding schizophrenia. As all we know, it's a chronic and mental disorder. And of course, it's not common as other mental disorders. And it comes in very young age, like in between 16 to 30. And many more categories and symptoms and criteria, and also the remedies and points has been highlighted, and also the purpose of the clinical trials. It's been really wonderful session, ma'am. Thank you so much. And the very next session speaker, Virendra Kumar sir, regarding mental health and legal profession and practice. Sir gave us a little feedback this regarding ethical aspects of mental health care and its acts, and also the clinical practices. And as all we know, diagnosis is the preliminary key thing to get a patient or a subject mental status examinations, and the documentary evidence is a preliminary point for the mental illness, and many more recovery points. It's been a really wonderful session, sir. Thank you so much. And the very next session speaker, Nagaraju sir. Sir really gave us wonderful points in our how we're supposed to cope up things, and what are the multiple approaches, challenges and therapies and medications, and the coordination between the body and positive mental health, and what are the challenges we do really go through in our day-to-day life activities, how we're supposed to balance them. It's been really wonderful experience, sir. Thank you so much. And the very next session speaker, Dr. Chandrakala ma'am, regarding mental health problems among youth and towards a sustainable solution. Ma'am also gave us a wonderful observations like the causes, in the, like physically, emotionally, and the challenges we are going through, and the competition struggles, and several approaches in our daily activities, and how we're supposed to manage stress levels. It's been really very good session, ma'am. Thank you so much. And once again, I thank Dr. Ravindra sir and his team, Sri Holistic Health Foundation India, Sri Research Institute, Center for Arts, Sciences and Wellbeing for this wonderful opportunity to propose vote of thanks, and also to express my gratitude, and also to be a part of Azadi Ka Amrit Mahotsav celebrations and international seminar today. Thank you all.
Thank you, Manasa, for the proposing vote of thanks. And I thank each and everyone, all the speakers and all the participants, without which this international seminar on mental health and sustainable development wouldn't have been successful. I congratulate each and everyone for being part of this wonderful international seminar, and keep joining us daily from 6 to 8. We have international webinar series and Sundays 11 to 5. It's a very good opportunity for everyone. If you are a subject expert, you can join and enlighten everyone and share your knowledge with everyone. It's a very good opportunity as part of being Azadi Kamrat Mahotsav. So once again, I thank each and everyone for joining us. And you can fill up the final feedback form, overall feedback form for this session. And you may leave the platform after filling it up. Overall feedback form has been launched. So quickly fill up the feedback form. And thank you once again, everyone, for joining us. See you all tomorrow at 6 o'clock. Take care. Good night. Dear friends, quickly fill up the feedback form before you leave the platform. Certificates will be updated on the website. You can download certificates from the website. After specified time, we will update you in the Telegram channel and also on Facebook group about issuance of certificates periodically. We can also check website for updates. You will find a Google Drive link on the website from where you can download
Sir, please send in the group. That would be nice of you.
Yeah, we will share the information with us.
Website, it is difficult for me.
Yeah, sure.
Thank you, Ravindra sir.
Thank you, ma'am. If you have completed filling it up, you can leave the platform. We are waiting for others to fill up the
We have tomorrow also session. Please, sir, do we have the session tomorrow also? I was very
daily, daily we have 6 to 8
and
on different topics.
same
With
link,
this,
sir. Same link.
same link for all day.
Thank you and good night.
Thank you. Take care.
Sir, done.
Take care. Good night.